ILS continues to study the Philippines' labor and employment situation towards the future of work. ILS continues to be committed to uninterrupted operations anchored to its core values of integrity, excellence, public service, innovation, and compassion. The ILS is also guided by its overarching agenda to protect workers and engage wider communities towards a more robust economic scenario leading to a post-pandemic employment recovery. It continues to be at the forefront of bridging labor and employment research, policy, and practice towards inclusive growth to influence and create more positive and impactful works towards a decent work for all.
Good afternoon to our colleagues from the Institute for Labor Studies, our attendees via Zoom, from the DOLE senior officials, bureaus and services, as well as our development partners. Welcome to the ILS Development Advocacy event dubbed No Health Without Mental Health, Advancing Mental Health Promotion in Workplaces. I am Michelle Ann Ruiz from the Advocacy and Publications Division of the Institute for Labor Studies. I will be your facilitator and host for today's event. Before we begin, let us bow our heads for a short prayer.
Heavenly Father, we come to you today with humble hearts, seeking your guidance and wisdom as we begin this program. Lord, we ask that you would bless every person who has gathered here today, and that you would be present with us in a special way. We pray that this program would be a time of learning, growth, and fellowship for all of us. Help us to listen to one another with open hearts and open minds, and to support one another as we strive to serve you in all that we do. Please give us the strength and the courage to follow your will and to use the gifts and talents you have given us to make a positive difference in the world. We pray all of this in your holy name. Amen.
At this point, we would like to acknowledge the presence of our attendees from the DOLE officials and attached agencies. We have the Bureau of Local Employment, Bureau of Labor Relations, Bureau of Working Conditions, Bureau of Workers with Special Concerns, and attached agencies coming from the Employees Compensation Commission, National Conciliation Mediation Board, National Labor Relations Commission, National Wages and Productivity Commission, Occupational Safety and Health Center, Professional Regulations Commission, Technical Education and Skills Development Authority. We also have the following DOLE services in attendance today: Administrative Service, Financial Management Service, Internal Audit Service, Human Resource Development Service, Information and Publication Service, Legal Service, and Planning Service. We also have today in attendance our participants from the regional offices, development partners, and our external attendees. We also have attendees tuning in live via our Zoom official Facebook page. Before we proceed, we have a few event reminders for the successful conduct of this session. First, please be reminded that the conduct of the webinar will be recorded for documentation purposes. Your attendance today and by voluntarily signing the form, participants consent to the collection of the personal information being asked in the said form. Participants are reminded that event is documented through audio, photo, and video. Secondly, kindly rename yourselves in Zoom to organization underscore full name for us to identify you properly during the session. Kindly also use the Zoom background that we sent via chat that we'll use for the photo opportunity later. Later, we will also have a 30-minute open forum after the discussion. We will entertain a maximum of 10 questions from our Zoom attendees. So kindly list down your questions, or you may type in the chat box for your facilitator to read to our speaker. And now, to give us the opening remarks, may I call on our Deputy Executive Director of the Institute for Labor Studies, Attorney Mary Grace L. Riguer, to Joshua. Okay, so we will go back to our opening remarks later. So for our program for this afternoon's webinar, let me share this with you first. Overall, this webinar aims to steer discussion on improving mental health promotion in workplaces. Specifically, it aims to foster greater awareness and understanding of mental health in workplaces. And to highlight the promotion of workplace mental health policies and programs, we have the following topics for discussion. First, we will have the mental health policies in formal workplaces, occupational environment and our mental health, and of course, a call to action in support of mental health in our workplaces. Without further ado, let us move on to our first presenter. The discussion will focus on mental health policies in formal workplaces. The presentation highlights the importance of integrating mental health policies in workplaces. Our discussion may include policies and guidelines for implementing mental health policies, programs, and trends. So before I proceed with the introduction of our speaker, may I call on once again our Deputy Executive Director of the Institute for Labor Studies, Attorney Mary Grace L. Riguer Teodosio, to give us the opening remarks.
Good afternoon, Michelle. Good afternoon, everyone.
Good afternoon, Didi.
Okay, good afternoon to our esteemed participants and guests. My colleagues at the Department of Labor and Employment, officials, friends, partners, I warmly welcome you to this webinar, No Health Without Mental Health, Advancing Mental Health Promotion in Workplaces. The Institute is delighted to share with you awareness and promotion of mental health issues in workplaces, and also giving an emphasis on the importance of implementing mental health policies and programs. Thank you for being with us today. Can you give us a minute?
Okay po, Didi.
Okay. Okay. Sorry for that, no. In accordance with the Mental Health Act of 2017, the Department of Labor and Employment issued Department Order number 208 to reiterate making mental health in workplace policy and program mandatory in all private establishments to cover aspects such as preventive interventions and treatment combined with support measures such as advocacy and information, work arrangements, and work accommodation. In 2020, the Civil Service Commission issued Memorandum Circular number 04 to likewise require all government agencies to craft individual mental health programs. In today's seminar, resource persons will help us gain better understanding of these policies and programs and introduce us to the nature and requisites of mental health in workplaces, mental health conditions that may affect the well-being of workers, and strategies and interventions that should help employees address their conditions. In particular, we will delve into topics such as overview of mental health and well-being, implementation of policy initiatives on mental health in the workplace, and program initiatives on mental health in workplaces. Therefore, we thank in advance our resource persons, our experts, who will share their expertise on mental health. Dr. Felix Labanda, Junior of the Bureau of Working Conditions, and Dr. Reynold Santa Ana of Occupational Safety and Health Center. Our colleague, Miss Lara Fameronag, will also give us or share her experience and her advocacies on mental health. She's from the Institute for Labor Studies. So we encourage everyone to actively participate in today's webinar, and we will definitely welcome comments and further inputs. Through this webinar, we hope to destigmatize those affected with mental health issues and normalize discourse and discussions to recognize and promote mental health in workplaces. Again, good afternoon. Thank you.
Thank you very much, our DED, Deputy Executive Director, Attorney Mary Grace Eudosio, for sharing with us your insights for today's webinar and for also welcoming our attendees today. Truly, our discussion today is timely and relevant and will benefit not only our workers, but of course, our tripartite partners tuning in today. So without further ado, let me introduce our first speaker for today. Our first speaker is currently the Supervising Labor and Employment Officer of the Bureau of Working Conditions, PMP-SSD, of the Department of Labor and Employment. He earned his Doctor of Medicine degree at the University of the East Ramon Magsaysay Memorial Medical Center and his Master's in Occupational Health at the University of the Philippines College of Public Health, Manila. He has a breadth of experience as a physician in various industries focusing on occupational safety and health. Let us all welcome Dr. Felix F. Labanda Jr. to discuss mental health policies in formal workplaces. Let us all give him a round of applause.
Thank you for the kind introduction, Michelle. I'll just share my slide. Okay, can I get a confirmation that you're seeing my slide in presentation view?
Yes, Doc.
Okay, thank you. So good afternoon, again, good afternoon to everyone that is attending this webinar on mental health. So this particular session is entitled Mental Health Policies in Formal Workplaces, which is part of the No Health Without Mental Health advocacy of the Institute for Labor Studies. Now, this particular talk that I will be providing focuses on the policies, the laws that is involved in the mental health in the workplace. So in everything that we do, especially for those of you that are part of HR o yung mga nagsusulat po ng mga policy for the company, you have to know that each time that you write a particular policy, the legal basis for such policy should be known to you, or you're very familiar with it, for you to be able to write the policy and get the wisdom of the policy or the law and translate it into day-to-day occurrences. So under RA 11036 or the Mental Health Act, it is an act establishing the National Mental Health Policy or the Mental Health Law. So that's the shorter name for this particular law. Now, the movement for this particular law is that on June 20, 2018, this was enacted by then PD President Rodrigo Duterte, and then was published in the Official Gazette on July 2018 and took effect on July 2018. And the Department of Health issued the implementing rules and regulations on 2019, which was published on the Philippine Star on February 4, 2019, meaning the IRR took effect February 19, 2019. So why is this timeline very important? This tells us that this is not just something that we thought about and then it's already available, because even if we know that mental health is an issue or is an existing thing in the workplace, for it to be officially recognized by the country as something that must be looked into is very critical, because the resources that would be allocated for this particular disease or this particular condition is already set, kumbaga, no? Now, for this particular law, it's not moving. Okay, so for this particular law, there are certain salient features that you must that we should be aware of. So hindi ko na po iisa-isahin yung components ng batas kasi that's going to be long. It's important lang na maintindihan natin na in the 11036, it makes treatment available at all levels, meaning there should be preventive, there should be prevention, there should be a means for treatment, there should be a means for return to work. And there should be an integration of mental health services in the Philippine general healthcare system, meaning it's not just about the National Center for Mental Health, it's not just about specialized hospitals, but it's the integration of mental health services in all levels. Remember, when we say all levels, it's not, parang hindi natin gusto na pupunta ang worker na mayroong mental health condition sa isang mental health institution dahil hindi natin agapan. So yung preventive aspect, diba, there are several layers, the primary, secondary, and tertiary levels of prevention, hindi na natin siya naibigay. So binaba ng batas na to that there should be a preventive aspect in the prevention of mental health deterioration. And it required government agencies to spread awareness in schools and workplaces. So this is where DOLE came in, because we are mandated to spread it in workplaces. But it also required mental health professionals, workers, and other service providers to undergo capacity building, reorientation, and training. And that is exactly what you're doing now. Before the advent of the mental health law, these kinds of training, you don't have any legal backing while you're going to undergo the training. But after it was enacted, after the issuance of the IRR, after the issuance of the DOLE Department Order, which I will be discussing later, meron na po tayong basis for our training, and we know what we are supposed to be doing as a group because it's a system. So it also created the Philippine Council for Mental Health. So what is the Philippine Council for Mental Health? So this is an aggregation of the different government agencies as well as those that are treatment or service providers to provide sort of guidance and overarching look or overarching view on what is involved in the provision of mental health services. Who are the mental health or the service users, should I say? Who are the service users? What are their problems? What could be addressed? What cannot be addressed at the moment? Because mental health is such a wide-reaching issue that it could not be. If we try to hit everything that is related to mental health, wala po tayong matatapos. Kaya po nagpa-prioritization during the Philippine Council for Mental Health meetings. And of course, it also provided penalties for violations of such. Now, in the law, there was also a discussion on the rights of persons with mental health concerns. So of course, there should be humane treatment. There should be freedom from discrimination and stigmatization. Those that are suffering from mental health conditions should be able to exercise all inherent rights, either social, political, or religious. There should always be confidentiality of all information. This is very much protected by the Data Privacy Act of 2012. And there should be access to mental health services at all levels. This was very, very critical in the provision of 11036. There should be an avenue through which those that are considered as service users have a say on what would be provided for them during the health advocacy, planning, and legislation, so that there is a means for you to be participative on what would be delivered by the particular program of the government. And there should be an informed consent before receiving treatment. So hindi na po pwede na you have a mental health condition, whether you like it or not, you will be confined and you will need to receive this treatment. So we are moving forward towards humane treatment. So kailangan po may informed consent. Always po yan. And then of course, for those that are incapable already of deciding for themselves, they should be appointed legal representatives. So this is very particular for those that have lost the insight on what is right and what is wrong, or what is beneficial for them or not. Now, meron pong binilabas na duties and responsibilities ng DOLE doon. So, sinasabi po doon sa Republic Act, we should develop guidelines and standards on evidence-based mental health programs for the workplace and develop policies that promote mental health in the workplace and address stigma and discrimination suffered by people with mental health condition. So sa IRR naman po nilabas, sinabi na dapat po meron nga po talagang policies and programs na coordinated with the Department of Health as well as the mental health experts. And then develop mental health programs for the OFWs and then provide assistance for employees in the development and promotion of mental health programs in workplaces. Now, there is an issue here, of course, if you are familiar with, by 2023 or the start of 2023, January of 2023, the Department of Migrant Workers is already in full scale, meaning the concerns for the overseas Filipino workers have already been transferred to the Department of Migrant Workers. So lahat po ng palabas ng bansa nasa sa kanila, but hindi naman po sila basta na lang binitawan, kumbaga. Meron po tayong communication din, but ito po ay nangyayari na through the Philippine Council for Mental Health. Kasi doon po talaga nag-aggregate, doon po kami nakikita-kita yung technical working group para po mapag-usapan ano po ba talaga ang po pwede natin gawin, ano ang kakayaning gawin. Now, doon din po, ito rin pong IRR na to, ang naging basihan para po ma-develop natin ang mga provisions po na nilabas ni DOLE. But kami po ay guided din po ng mga punishable acts na nakasulat po sa RA 11036. So, nandiyan po yung failure to secure informed consent. Meron po kayong treatment na gustong ibigay, hindi kayo nagpa-consent. So, violation po yun, punishable act po siya. Violation of confidentiality of information. Of course, ang daming batas po na nakapalibot dito. Discrimination against person with the mental health condition. Ito po, kailangan po mapatunayan na may discrimination, pero at the same time, nagkakaroon din po tayo ng avenue na, alam ko na hindi ako pwedeng i-discriminate because of my mental health condition. And of course, the administration of inhumane, cruel, and degrading or harmful treatment. Ayaw na po natin na habang ginagamot mo sa isang sakit, lumalala naman sa kabilang side. So, the penalty for such punishable acts would be 6 months to 2 years and or 10,000 but not greater than 200,000. So yun po yung kanilang penalties. Ano po ang focus areas natin dito? When the 11036 was issued, pati na rin po sa IRR, sinasabi po nila na dapat nakatuon po tayo sa 3 lugar. So ano po yung 3 lugar na yon? School, and of course there's the workplaces. Pero saan po sila nakikita? They are seeing each other in the communities. So hindi po pwedeng magkakahiwalay po yan. Ito rin po ang nagiging basihan. Kaya po nagkaroon nga po ngayon ang Department of Health ng 3 approach sa mga sakit. So pag na-encounter nyo, meron po tayong tinatawag na healthy communities, healthy workplaces, and healthy learning institutions. So ito po ang nagiging basihan kasi moving forward po, nagkakaroon tayo ng mga settings kung saan maaaring magkaroon ng entry point ang pagtulong po natin doon sa mga nangangailangan. For the Department of Health, Department of Labor and Employment naman po, naglabas kami ng Department Order 28 Series of 2020. So, noong 2020 po namin ito nilabas. Ito'y pinublish po noong February 17, 2020 and was effective March 4 of 2020. So, prior to the start of the pandemic, medyo sakto po kasi during the pandemic, ang dami po talagang nagkaroon ng mental health problems. Kaya lang po, ang naging problema nito, masyadong maagang dumating yung mental health problems. Hindi pa tayo lahat halos handa. But we already have a law that says, tingnan mo yung mental health condition ng inyong worker, hindi lang po basta pinabayaan ninyo. Remember that in mental health, hindi po kayo basta nagpapa-institute ng inyo pong mga policies. Kailangan po, there should be a raising of awareness through which, pag na-erase nyo na po yung, napataas nyo na yung awareness, magkakaroon na po kayo ng correction of stigma at mapaprevent nyo na po yung discrimination. And then mag-identify na po kayo ng support for individuals that are at risk or have identified themselves to be at risk or in need, and then facilitate access to treatment and psychosocial support. Kung gusto po natin ito, magabayan po ang lahat base po sa sinasabi ng batas, Magna Carta for Disabled Persons, at yung OSHLO po natin or yung DO 198-18 na nakabase po sa RA 11058, United Nations Convention on the Rights of Persons with Disabilities. Kasama na rin po dito yung Safe Spaces Act at saka yung iba pang mga policies and programs. relevant policies, I mean. Now, doon po sa batas and sa department order po natin, specific po nakaatang po kay Dole, ang workplaces po na nasa formal sector. Bakit formal sector lang, Doc? Bakit hindi kami kasama, informal sector kami? Kasi meron po itong inuutos sa employer. Ang sinasabi niya sa employer, siguraduhin mo na meron kang policy and program. Madali, pwedeng naman gawin mo rin kahit ikaw ay worker-employer. Pero, paano pag sinabi na merong parusa? Ikaw rin ba ang paparusahan? So, medyo iba dapat yung approach siguro. So, dun po, dun kaya medyo very particular po tayo na sinasabi na workplaces in the formal sector, including those which we deploy sa tulad ng ating overseas Filipino workers. However, ang caveat po nito, since this was released early 2020 and the Department of Migrant Workers was only activated in 2023, hindi pa po ito nako-consider na maililipat na po yung OFW. So kasama pa rin po siya sa scope and coverage of the DO208. However, with the start of the DMW, nilipat na po natin to kay Department of Migrant Workers. So ano po sinasabi na responsibility ni Dole? Kami daw po ay mag-develop ng guidelines and standards. Yun po ay nakasulat na dito. As well as the policies that promote mental health in the workplace. So inutusan natin, kayong mga establishment, tingnan ninyo yung mga kumpanya, utilizing the hazards identification, risk assessment and control na inyo pong ginagawa in compliance with DO 198-18, tingnan po ninyo ano po ang kailangan ninyo sa inyo pong policy and program. So nandun po yung basis ng pagsusulat. Nung nailabas natin po ito, syempre, nagkaroon po tayo, nag-focus na po tayo sa pandemic. Ano po? Nagkaroon ngayon ng parang recovering from the pandemic. Of course, when you're starting to recover, you also need guidance on what you're going to do. That's why in 2023, ngayon lang po, kaka-release lang namin, the Department of Labor and Employment released Labor Advisory number 19, which is supplements the implementation of the mental health policy and program in the workplace. So yung iba sinasabi, Doc, parang ang hirap po basahin, parang hindi ko naintindihan yung iba. Ang requirement po ng Labor Advisory number 19, you have already read Department Order 28-20 and it's already existing, meaning meron na po policy. Nandoon lang po tayo sa pagpapaganda, pagpapalawak, pagiging inclusive, kumbaga. So, hindi po pwede na you are starting with Labor Advisory number 19 without knowing DOLE Department Order 208, without knowing Republic Act 11036. Kaya po yun yung sequence ng ating pagdidiscuss. You start with the law, go to the IRR, go to the department order, and this is the labor advisory. So, 4 po yung dinadaanan. Yun po ang minimum requirement natin para po doon sa mga magpapatupad or magsusulat po ng policy and program for mental health in workplaces. So, please ensure that when you do your policy writing, kayo po ay may legal basis, of course. And then, meron din po kayong pag-check ng mga corollary law and issuance. So, nandyan po ang ating pong, yung mga nabagit ko ng batas kanina, as well as the Labor Code of the Philippines, yung Universal Healthcare Act or yung RA 11223, as well as the PhilHealth Circular Number 2020-0022. So, I will discuss this later. Now, yung ating pong DO 208-20, ito na po siya, di ba? Ito yung nilabas namin noong February 11, 2020. Now, kailangan po, during the time na ito ay nilabas, nagkaroon na po kayo ng company adoption and implementation. So, from that particular department order, pwede nyo pagandahin using the labor advisory or expand nyo pa, you create the policy and implement it. However, providing the policy does not automatically mean that it's being felt by your workers. So, kailangan po magkaroon ng worker information and service utilization. Pag wala pong uma-attend ng inyong awareness raising campaigns, wala po kayong nakikita na ang dami nang nag-iiyakan sa mga manggagawa nyo, pero wala pa rin nag-a-avail ng employee assistance program, then something is wrong either with the policy or how it is being implemented. Now, ang ating pong Labor Advisory number 19 on mental health in the workplace, ito po yung kanyang legal basis. Mapapansin niyo po, we are very keen on what is the basis for a particular labor advisory or department order. This is because importante po na alam niyo rin kung saan niyo ibabangga yung ginagastos niyo. Kasi pag sinabing you're spending X number of pesos for this particular condition. Why? Because the law says so. Dapat merong ganon. Also, kailangan po nating tingnan yung ating pong work accommodation, flexible work arrangements, confidentiality of records, as well as reporting po nyo kay DOLE. Now, pag inyo pong tiningnan, doon po sa labor advisory, meron po tayong coverage na lahat po ng workers in the private sector ay kasama. Pero ini-encourage na lang po natin ang paid leave benefit and other benefit. Ano po ito? Ibig sabihin, kung meron na po kayong available na service incentive leave, meron na pong nag-i-exist na leave sa inyo pong kumpanya, maaring ito na po ang gamitin. Pero ini-encourage po ni DOLE na kung halimbawa sobrang stressful yung inyo pong workplaces, o kaya yung mga workers niyo ay nagka-clamor na ng mental health break. We had several of this during yung kasagsagan ng pandemic. Naghahanap sila ng mental health break because na-overload yung mga tao. So you have to have a means na parang, okay, during the time na ito ay nangyayari, ano magiging basihan natin? Doon nyo po siya ipapasok sa policy na in case a situation arises, meron ko yung pagbabasihan na ito ang gagawin natin. Kasi ang purpose po natin sa policy and program is to ensure that when we are implementing a particular rule, it is written down so we are implementing it uniformly. Hindi po siya arbitrary, depende kung anong mood ng mga nagpapatupad. So yun po yung purpose natin sa policies and programs natin. Now, meron po tayong components dito ng rescheduling of work hours, telecommuting, work accommodation and arrangements, as well as flexible work arrangements. Hindi po ito masyadong hinighlight sa Labor Advisory 19 because it's already incorporated into DOLE Department Order 237 Series of 2022, which is in response or as part of the spin-off from the Telecommuting Act. So ito po yung implementing rules and regulations for workplaces. Ano po? Now, kailangan po maintindihan din ninyo that even if there is confidentiality of records, it does not prevent you from reporting to us. So, of course, this is two sides of one coin. So how can you say that you're reporting to DOLE and yet still maintaining confidentiality? When you are talking about confidentiality, you keep the medical records of your workers confidential. You keep it in your clinics as needed, or if ever, you keep it with the service providers. But for DOLE, in reporting to DOLE, you are asking only the numbers. How many attended your awareness raising? Do you have an awareness raising campaign? It's not about the patient. It's about your efforts in the prevention or the preventive aspect of mental health. Now, the salient features of Labor Advisory 19-23 focuses on these four aspects. First off is the National Mental Health Crisis Hotline. So this particular Labor Advisory provides the numbers that workers and the employers may be able to call if there is a mental health crisis or if they think that they need guidance. This activates the National Center for Mental Health, who can provide for you the necessary information relating to mental health. Also, there is a access point for those that want to use the Lusog-Isip application. So this is easily downloadable or accessible using the lusog-isip.doh.gov.ph or the selfhelp.cbdr.org.ph. Alongside with this, we are also referring you to the PhilHealth Consulta package, which is provided by the PhilHealth, of course. But this is only through PhilHealth accredited institutions. So you need to have referrals to the DOH retained hospitals or rural health units that are accredited with PhilHealth Consulta. In relation to that, the PhilHealth issued PhilHealth Circular 2023-0018, which covers the following services. So it covers initial and follow-up consultations, assessment, diagnostics, psychological interventions, and these are offered through the general specialist package. And also, once the worker is discharged, there should be availability of mental, neurologic, and substance abuse medicines for the continuation of the treatment outside of the mental health institutions. When workers want to avail of benefits, they have to avail it from accredited mental health providers. If they opt not to avail it through that, they cannot reimburse it or they cannot avail it in any other facility. So it's a means for the PhilHealth to control who is getting treatment where. And then the services covered for the package rate of the general mental health package, which is 9,000 per patient per year, is screening, psychoeducation, and psychosocial support, assessment based on MHGAP, diagnostics, 12 follow-up visits maximum, and medicines under the MNS. For those that are requiring special mental health package, which amounts to 16,000 pesos per year per patient, ang availment naman po ng services is from number 3 to number 7. So ito po yung assessment ng MHGAP, diagnostics, follow-up visits with the doctor, medicines para po dun sa inyo pong gamutan, and of course, psychotherapy. And then, ayan, yun na pala siya. Oo, hiniwalay ko pala lahat. So ito po yung nakahiwalay siya. Baka po hanapin nyo siya sa Labor Advisory. Ito po ay not included in Labor Advisory number 19-23. Sinama ko lang po kasi ito po ay inilabas po ng PhilHealth ngayong Mental Health Month ng pong October. Ano po? Thank you very much for listening.
Ayan. So thank you very much, no, Dr. Labanda Jr., once again for a thorough presentation that provides sufficient knowledge on mental health policies that we should be aware of in the workplace. So nakita naman po natin, no, we have a number of DOLE policies and issuances. Of course, we also saw na meron mga bang national government agencies and their initiatives to promote mental health in the workplaces. So truly knowing all about these policies and guidelines will equip our workers and especially yung ating mga partners in the business community to ensure that these policies are followed to foster, of course, a conducive working environment. So thank you very much once again, Dr. Labanda Jr. So surely yung mga attendees po natin may have some questions, no, regarding these policies. So we request Dr. Labanda Jr. to kindly stay for a while for the open forum shortly. So thank you very much, Dr. Labanda. So we have a few comments lang po, no, sa ating Zoom. So as a comment from Ma'am Alumbro Menchavez, I am diagnosed with a mental illness and PWD since 2018. This is a very timely and significant to me. Malaki ang nabawas na prices ng NCMH since the law was passed and libre na lahat per consultation. So marami po salamat sa inyong comment. And another, of course po, we will be asking the consent of our presenters to share with you mamaya po yung ating mga presentations. So later we will share the presentations after this webinar. So once again, thank you very much, Dr. Labanda Jr. So let's move on to our next presentation. So our next presentation will focus on occupational environment and mental health. So this topic will underscore the relationship between occupational environment and, of course, mental health. We will discuss the relationship of these factors in some studies on mental health and some of the government's training and services extended to our fellow stakeholders. So without further ado, for our next presentation, allow me to introduce our next speaker. He is an occupational medicine physician by profession and is currently a senior occupational health officer under the Health Control Division of the Occupational Safety and Health Center of the Department of Labor and Employment. Furthermore, he finished his baccalaureate studies at the De La Salle University and earned his Doctor of Medicine at the Manila Central University Philemon B. Tanchoco Medical Foundation. Consequently, he took his Master of Occupational Health at the University of the Philippines College of Public Health. He is also one of the resource persons who conducts various occupational health training at OSHC, like medical surveillance, mental health, work-relatedness of diseases, ergonomics, drug assessment team training, and managing emerging health issues in the workplace. Additionally, he is a diplomate and fellow of the Philippine College of Occupational Medicine. Having said that, let us all welcome Dr. Reynold M. Santa Ana. Let us all give him a round of applause.
Thank you very much, Ma'am Michelle, for that very kind introduction. So, can you hear me? Thumbs up
Yes,
po
Doc.
tayo. Okay, thank you. So, let me share my screen. Okay, so check ko lang kung nakikita niyo po ang aking screen at presentation. Yes po, okay po. Hello?
Yes,
Yes, we
Doc.
can see your presentation, Ray. Thank you.
Okay, thank you, Felix. So for the second presentation, I will be presenting to you the occupational environment and mental health. With this session, we will be discussing the relationship between the occupational environment and one's mental health. Iko-connect natin yung mga external factors, no, that affect our mental health by establishing yung relationship ng occupational factors and health and well-being. I-present din natin yung mga studies conducted by the Occupational Safety and Health Center related sa mental health and our agency services and training. So lahat tayo nakaka-encounter ng hazards kahit saan, no? Lalo na sa workplaces natin, no? Ito yung mga balikan natin yung mga occupational health hazards, no? They are the physical, biological, chemical, and ergonomic stresses, no? Pero under ergonomic stresses, andyan psychosocial hazards belong to ergonomic stresses, no? These hazards increase the risk of developing mental health conditions like stress, job dissatisfaction, anxiety, depression, and others. So, what are psychosocial hazards? So, these are interactions between and among work environment, job content, organizational conditions, and workers' capacities, needs, culture, personal extra job considerations that may, though perceptions and experience, influence health, work performance, and job satisfaction. O, sabi ng International Labor Organization. No? Sabi po naman ni Cox and Griffith, ang psychosocial hazards ay ang aspeto ng design and management of work and its social and organizational context that have potential for causing psychological or physical harm. So yan po yung link natin in increasing the risk for mental health conditions. So yung pinaka-connect natin or interface natin at pinaka-culprit, no, ng increasing the risk of mental health conditions in relation sa ating environmental factors ay yung stress natin. So, what is stress? As defined by the International Labor Organization, this is the harmful physical and emotional responses caused by an imbalance. So, take note nyo itong imbalance. What kind of imbalance yan? Between perceived demands and perceived resources and abilities of individuals to cope with those demands. So imbalance siya ng demand saka nung perceived resources and abilities ng isang worker to do the task, to complete the work. Yan. So sinabi dito imbalance, the demand is greater than doon sa abilities ng worker to complete the task or to do the demand or to finish the job. No? Stress occurs when the pressure is greater than the resource. Pressure pertains to the demands, no? Then the resource pertains naman to the abilities and skills and talents ng mga workers natin in completing their job. So pag mas mataas yung demand kaysa dun sa kakayanan nila to accomplish yung kanilang mga tasks assigned, stress produce. Yan, stress will occur. Okay. So, sa work-related stress naman natin, ganito rin, no? Imbalance because they do not match. Yung do not match yung demands and yung capabilities and resources ng mga workers, no? Ano-ano ba yung mga example ng demands natin? Yung time, no? Ano ba? Yung mga workload, yan, for example. Yan. Tapos yung capabilities resources is our ability, yung talent natin, yung skills natin, yung mga tools natin, equipment natin to na kailangan natin to complete the tasks and other resources na kailangan natin para magawa at matapos natin yung trabaho natin. So tatanungin ko kayo dito sa panelist, no? Um, you can chat, you can write sa chat box ano yung mga reasons bakit tayo nai-stress sa trabaho. Or ano-ano yung mga na-identify ninyong mga stressors ninyo at work. You can write sa chat box.
Chat is disabled daw, Ray.
Chat is disabled. Okay. Sige. So, marami tayong mga factors, no, kung bakit tayo nai-stress sa work. And these are the psychosocial hazards, no, in relation doon sa work-related stress natin. So, sa mga naiisip ninyo na ilagay sa chat box, no, andito lahat yon, no? Like yung sa equipment natin. Bakit ba tayo nai-stress, no? Sa mga gamit natin. Minsan, meron tayong mga technological breakdowns, no? Like yung mga magpe-prepare ka ng presentation, tapos biglang nawala or nabura yung PowerPoint mo, syempre nakaka-stress yun, no? And pag nag-breakdown yung projector or yung laptop natin na magpe-present tayo or kahit sa gitna ng presentation natin, nag-update yung inyong laptop mo. So, yon yung isa yun sa problema natin. Masasabi rin nating stressor din natin yon, no? Pero most common yung ating workload, ano ba yung mga trabaho natin, di ba? Na sobrang dami ng task na inassign din sa atin, yung mataas yung demand na for us to complete those tasks, no? And also yung work pace, yung masyadong mabilis, yung fast-paced na yung ang dami-daming nangyayari sa isang araw natin, no? Nakulang pa yung isang araw to complete our assigned tasks. Okay. So dito, under work schedule, andyan naman yung under that yung ating shift work, no? Yung iba 8 to 5 ang work, yung iba night shift, yung iba graveyards na mga ibang industry. So they all experience stresses, no? So lalo na rin sa mga graveyard shifts and night workers, no? Bukod doon sa kanilang work at night, which is not physiologically naakma talaga sa atin kasi as our body is designed na paggabi nagpapahinga tayo at araw doon tayo gumagawa ng mga activities natin including work, no. Yan. So stressor din po ang ating mga shift schedule, no, yung shift work. Dito naman sa context of work, no, yung mga kultura, politics sa work, yan, yung communication problems, mga miscommunications natin with our peers, our co-workers. Yan yung mga nagdadagdag ng risk, no, sa ating pag-develop ng stress and eventually mental health as well, no? Yan. And our roles in our agency, our respective agency. Ano ba yung ating job description, no? So basically nakasulat sa job description natin, yung trabaho natin. Pero wait, there's more to it, di ba? So marami pa rin tayong task na ina-assign outside ng ating job description. And mapapaisip ka, ano na ba ako? Admin officer slash safety officer slash nurse slash doctor. Yan. So, yung ambiguity ng role mo, it's not defined and diluted, no? That entails a lot of responsibilities then, no? And a lot of talent and skills, no, for a particular role na kailangan nating i-fulfill. No? So, yun yung mga demands natin that produces stress or work-related stress and increase the risk of developing mental health disorders, no? To sa career development naman, yung lagi natin sinasabi na we are overworked palagi. Bakit? But underpaid, no? So parang mas marami pa talaga yung ating trabaho, no? And we feel that we are undercompensated. No? So for the decision latitude and control, sinasabi dito low participation in decision making, lack of control over work, yan, yung lack of control over work and yung decision natin to do the task, no? Saka yung control natin. Kung lack of control over the work, sinasabi rito, you do the task. Sinabi sa iyo kung ano yung gagawin mo doon sa trabaho. Bibigyan ka ng task, ito yung gawin mo. On the dot, ito lang yung iyong gagawin. Kung ano yung sinabi ko sa iyo, yan lang yung gagawin mo to complete your task. So, ibig sabihin nun, you have no control over what is the task being assigned of you. Yon. So, yun lang kasi yung gagawin mo. Not like na meron kang freedom and control doon sa inassign sa yung task. Like, binigay sa iyo yung task na, oh, ito, gawin mo. Submit that next week. So, you have a week na gawin yung work and alam mo naman kung ano yung gagawin. And meron kang strategy to complete the task even less than a week. So, yun yun. Parang binigay na sa'yo yung freedom and decision to complete the task. No? Wala na siyang ibang sasabihin instruction na eto yung gawin mo. Ikaw na yung bahala. So, that is increasing control. No? Dahil ikaw yung merong mismong sariling strategy to complete your task. Okay. Interpersonal relationships at work. So yan yung mga pakikitungo at pakikibagay natin sa kapwa nating mga co-workers, di ba? So meron tayong mga individual differences, attitudes, personalities. Yan, nag-i-interact tayo sa kanila, no? And yung iba good vibes natin, yung iba hindi natin vibes, yung iba iba yung parang tono ng pananalita. Yan, that leads to misinterpretation and miscommunication ng mga messages na sinasabi at dinideliver ng mga tao na nakapaligid sa atin. Kahit din sa atin, di ba? We are prone to misinterpretations, no? Pag meron tayong sinabi at iba-iba yung interpretation ng message, isang message natin sa iba-ibang mga kasamahan natin sa trabaho. And that leads dun sa conflict ng natin with each other, miscommunications dahil hindi natin naiintindihan, akala natin offensive na, akala natin galit siya, akala natin masungit siya, pero gano'n naman talaga yung kanyang personality. So, yun yung nagdadagdag din ng ating stress and increase yung risk natin for mental health conditions. Yan. Tapos yung ating homework interface, no? Sabi dito, conflicting demands of work and home, low support at home, and dual career problems. So before pandemic, defined yung ating work and home roles, di ba? Majority sa atin pumapasok sa trabaho. Alam natin, nagpe-prepare tayo going to work. Then pagdating natin sa work, magta-time in tayo. ang role natin doon, kung ano yung expected of us at work, kung ano yung position natin, what is expected of us, ano yung responsibilities natin doon sa pinapasukan nating trabaho. Then after our shift ends, so magta-time out na tayo, uuwi na tayo sa bahay, and iba naman ang role natin doon. Hindi na yung sa tungkol sa trabaho. Iba naman ang role. Pwedeng husband, pwedeng wife, pwedeng anak, relative, friend. Yan. So outside of work, iba ang role natin. And we wear a different hat doon versus doon sa hat natin at work. Nung dumating ang pandemic, we are forced to stay at home. And syempre, majority sa atin hindi na inalaw lumabas. And we are forced to work at home. So yung dalawang magkaibang environment, which is our work environment and home environment, kung nag-work from home tayo, nag-merge yung dalawang environment. So nag-blend siya and nag-mix. We all have different roles doon sa dalawa. So yung nag-iisang environment na pinag-merge natin ay we will handle yung mga different roles natin with those kinds of work and home environment. So yung iba, tumaas yung stress level nila noon kasi they're juggling mga multiple roles no sa iisang environment. No? So yan yung sa homework interface natin. And that leads to the increase in developing yung mga mental health conditions natin. So these are models of stress, no? Meron tayong mga example dito like yung kay Karasek, yung demand and control, yung ecological model ni Daniel Stokos, yung hierarchy of needs ni Abraham Maslow, and yung model of work stress ni Palmer, Cooper, and Thomas. So we would be discussing yung hierarchy of needs and yung kay Robert Karasek na demand and control model. So for Maslow's hierarchy of needs, so dito, syempre meron tayong hierarchy. Pinaka-base mo dito sa pyramid, no? Yung yung basic physiological needs ng atin. Sabi ni Maslow, kailangan nating i-fulfill yung basic physiological needs, no? Like survival natin ng air, food, water, and warmth, no? Then kapag na-fulfill na ito, aakyat tayo dito sa next hierarchy, which is yung sa safety. Safe, non-threatening, and healthy environment, personal security, and stability. No? Tapos yung social needs, then esteem needs, and self-actualization. Actually, ito na yung highest hierarchy mo, yung ating self-actualization. Kapag na-fulfill na natin itong mga needs na ito. No? During our lives, no, na-fulfill naman natin to, yung majority na siguro sa atin nandito na sa self-actualization. Pero somehow, in a way, na we need yung mga iba pa. Minsan na nawawala yung, nangangailangan din tayo ng ibang needs, no, na nasa lower hierarchy, no. And we try to make effort na ma-fulfill yung needs na yon, no. Like itong sa friendship and acceptance from others, kahit nandito na tayo, minsan nangangailangan pa rin tayo ng ganito sa ibabang hierarchy. And yung effort natin to fulfill yung lower need natin dito, and hindi siya natupad, at yung mga efforts natin na matagal na hindi pa rin natutupad, yun yung nagtataas ng stress level natin and nag-i-increase ng risk natin in developing mental health condition. Kumbaga, pag hindi natin, sinabi ni Maslow, kapag hindi natin na-fulfill yung needs natin, it will develop stress and increase the risk for mental health conditions. Okay. So for Karasek model naman, ito yung demand and control model. So 2x2 table siya. Lagay dito sa y-axis yung control and sa x-axis yung demand. Like yung control, na-discuss natin ito kanina, and yung demand, yung mga workload, yung mga time pressure, yan, yung mga highly demanding na aspeto ng ating trabaho pag mas urgent yung task na kailangan nating kumpletuhin, mas mataas yung demand, no? Yun. So, as you go high, kasi ito yung low control, pataas yan, no, to high control, no? Kumbaga dito sa high control, yung worker na yung may skill, talent to somehow complete yung kanilang task based sa kanilang abilities. So dito naman kung sa x-axis, yung low demand tapos high demand, no? Yan. Yan yung Karasek model natin. Sinasabi dito, in a particular type of industry, meron tayong low control and low demand, tapos high control and low demand, tapos yung ating low control but high demand, and both high demand and high control. Yan. So with less control and more demand, stress will generally increase. Kung mababa yung control natin, di ba? And wala tayong binigyan, we didn't have the freedom to do yung mga tasks natin based sa ating mga abilities, no? Stress will generally increase, no? Tapos with more control and less demand, stress will generally decrease, no? More control and less demand. Tapos dito, kung low control and high demand, yan yung etong matrix na ito, itong quadrant na ito, no? Low control and high demand increases the risk of psychological strain and physical illness. Kasi kung naman na high demand and high control, andito yung quadrant na meron kang learning and motivation, no? So, pwede mong isipin yung mga industries na may mataas ang control, yet meron ding mataas na demand. Compared mo, nandun yung parang learning environment, and nandito namo-motivate yung mga workers to um, learn more, work more, and do more outputs, no? Kung hawak nila or kung mataas yung kanilang control. At na-address nila yung mataas din na demand, no? Whereas dito, kung mababa yung control mo, tapos mataas pa rin yung demand, eh, wala kang diskarte nor freedom to do kung ano yung based saan yung ability to complete the task. Andyan yung development ng mental illnesses and psychological strain. In-emphasize din natin na stress will generally decrease if social support increases. So, in-emphasize din natin dito at lagi din natin ang pinopromote with mental health, we should increase yung social support ng ating mga colleagues and co-workers, no, doon sa ating workplaces, and to make workplaces more friendly yung saka mentally healthy environment din. Okay. So these are manifestations of stress, no? For you with psychological, we experience fatigue, anxiety, tension, irritability, depression, boredom, inability to concentrate, and syempre yung low self-esteem and confidence. With behavioral, some workers na kapag nai-stress, they resort to this coping mechanisms natin, no? Yung iba pag nai-stress, naninigarilyo, yung iba umiinom, and worse, yung iba gumagamit pa ng droga para daw makalimutan yung mga problema nila, no? Tapos, yung iba nagkakaroon ng impulsive emotional behaviors, poor work and family relationships, nag-isolate, at nagkakaroon ng mga problema sa family, and also sleeping problems, and also appetite problems as well, no? With the behavioral manifestations of stress, no? Generally, yung ibang mga workers natin, they resort to negative coping mechanisms, no? Pero we can educate them on how to cope with stress in a positive way, di ba? Hindi we can convert din siguro, or we can teach them, no, on how to cope positively, no, with stress. So meron ding physical manifestations and effects yung stress sa katawan din natin. So yan actually cutting across mga systems natin, no, merong effect din ang stress natin. So with this, meron tayong mga factors, no, sa work, ay yung mga culture, yung work demands natin, and decreasing in control, tapos yung ambiguity ng roles natin, tapos yung may mga changes tayo na management siguro or mga adjustment sa work during our course of employment, tapos yung dynamics ng ating um, relationships with co-workers and yung social support saka yung mga peer support. So regardless kung increase or decreasing social support yan, it will influence yung ating psychological hazards that will manifest kapag uh, increase yung ating stress level. Ito yung mga nararanasan natin, no, with the individual symptoms. Physiologically, ayan din, no? Saka yung behaviorally. Then organizational symptoms, kapag na-stress tayo, it will affect yung ating mismong enterprise, no? And nagkakaroon tayo ng yung mga enterprise ng increasing sickness absences kasi marami nang uma-absent na mga workers kasi nagkakasakit na rin sila kasi na-stress sila. Yan. Tapos yung mga long hours culture, increased staff turnover, reduce staff performance, reduce staff morale and loyalty, and increase hostility. So nandito na rin yung mga violence and harassment din, no? And in effect, may mga negative outcomes tayo that will lead to dun sa increasing anxiety, depression, burnout, and leading to mental health conditions. So these are the sample interventions natin based sa International Labor Organization, no, to prevent work-related stress, no. For control, ensuring adequate staffing levels. Ayan. Tapos allowing workers to say in how their work is to be carried out. So parang pinopromote nila to be yung workers natin to be assertive and mag-open up. Yan. Para yung communication natin ay malinaw at maayos. Yung workload, aayusin natin at i-carefully pace natin yung mga workloads natin and i-manage natin sila. Okay. At ipa-prioritize. Tapos increasing social support and also training. Kasi ang isang problema nung demand and control, di ba? Nagkaroon tayo ng imbalance between demand and demands and dun sa abilities and capabilities ng worker in completing the task. In training, mamamatch natin yung mga abilities kasi kung ano yung demand, we capacitate yung mga workers natin para maging level of at magawa nila yung mga demands and other tasks na inassign sa kanila. So, ibig sabihin nun, pag capacitated na sila with the demand, in relation to the demand, magmamatch na yung mag-equalize na yung ating demand doon sa capabilities and resources ng ating mga workers to complete the task. So kasama na rin dyan yung training and education, being open sa work, institute a culture of friendliness and openness, yan, transparency and fairness. And improving physical working environment. Pati yung ating mga mismong workstations, no, it is very important that we improve yung ating lugar, no, yung ating mga workstation. Kasi dito, kung ang workstation natin ay madumi, maingay, mausok, and mainit, no, hindi siya comfortable, makaka-contribute din yan. And it will increase yung risk natin in developing mental health conditions. So these are some examples, no, on how to cope with stressful situations, no. Yeah. So increasing social support, pwede rin sa meditation, meron tayong mga audio samples or clips sa internet or sa mga mobile apps natin. Meron mga ina-advertise doon na mga meditation apps, no? Tapos time management, this is important, no? Para malaman natin at makategorize natin on what is urgent and not urgent, what is important and what is not important, no? Tapos yung proper nutrition, of course, regular exercise kasi this increases yung happy hormones natin, no? Yung feel-good hormones natin, ng mga dopamine, serotonin, no? With exercise, no? And meditation with breathing exercises. Tapos yung mag-iisip tayo ng mga positive things about ourselves. Kasama na dyan yung mga self-affirmation, tapos being grateful, yan. Tapos i-convert natin yung negative thinking natin into a positive one. Yan. Tapos reading a good book, yan, para marami rin tayong matutunan dito and matutunan sa mga ibang experiences ng mga authors natin dito, no? Yan. And marami pa pong mga examples nito, no, in dealing with stressful situations, no? So dito, these are our researches, no, on related sa mental health. So from 2017, meron na po kaming ginagawang mga researches, no, related na rin sa mental health. Ito po kasi about work dissatisfaction, tapos yung shift work, tapos yung job stress and effort-reward imbalance andito. Tapos yung mga family work-life balance and also yung mga kung meron silang mga OSH policies and okay ba sila in sa work nila. Yan. So you can request yung kung gusto niyo ng details nito, you can request yung ating OSHC library to have a copy of this researches po. Okay. So for other trainings natin and services conducted by OSHC, we have these types of training, no? Yung ating drug assessment team training, yung ating workplace mental health training, yung managing emerging health issues in the workplace. So ito po yung ating right shop, no, na tuturuan namin kayo gumawa ng policy ng mga DOLE health issuances natin. And yung ating ergonomics in the workplace training, no. Ito po yung mga ang face-to-face natin ay 2 days po. Tig to 2 days po itong mga training na ito, no. Yan. And also we have learning sessions on this particular topics, no. Kung gusto niyo pong mag-request, no, you can write to the office of the or email to the office of the executive director for your request, no. Also, we do conduct Zoom webinars related dito sa OSH and any assistance and advice in policy and program formulation. So sa trainings natin, you can email us with pertaining doon sa kung ano po yung training na interesado kayo. And inaayos na po namin yung aming schedule for next year for this training, no. Yan. I think that's about it. Thank you very much po. Back to you, Ma'am Michelle. Thank you.
Ayan, thank you very much, no, Dr. Santa Ana, for that comprehensive presentation, no, on the relationship ng occupational environment at ng mental health natin. Some of the key takeaways, no, nakita natin yung how economics play sa mental health and of course sa ating working environment, no, and how we can cope with stress and also yung ating mga ways on coping such as self-affirmations, reading various books on self-help especially. So thank you for that comprehensive presentation, and we genuinely appreciate, no, yung presentation on how you frame the discussion on the relationship of occupational factors, health and well-being, and of course, no, the OSHC policy, has a roster of training. So maybe we can also bank on that, no, yung iba't ibang initiatives ng ating OSHC to promote mental health in the workplaces. So similarly, we request Dr. Santa Ana to stay for a while for the open forum shortly. So thank you, Dr. Santa Ana. So I would like to announce, no, to our attendees, as you all know, we are on a webinar format here in Zoom. So we will be promoting our attendees, as many as we can, to panelists, so you can also interact with our presenters. So don't worry, for those in the webinar, we have the Q&A button at the bottom of your Zoom. At the bottom of your Zoom, you can check your Q&A button. So if you have questions directed to our presenters, just post your questions there. So let's without further ado, let's move on to the last but definitely not the least of today's webinar. So our next topic comes from an experiential account. Now we will discuss the significance of one's mental health and well-being and some of the practical ways to promote these advocacies in the workplaces. So after all that we have discussed about the policies, we have discussed about the economics of stress in the workplace, and how the occupational environment affects our workers when it comes to their mental health. So let's now delve into our call to action. No? So how can we better support our stakeholders? So now let's hear it. Our next speaker is a mental health advocate and one of our homegrown talents here in the Institute for Labor Studies. She is a labor and employment officer and also serving as the vice president of the ILS Employees Association. To give us a message of support and to provide the call to action for mental health promotion and awareness in workplaces, let us all welcome Ms. Lara P. Famironag. Hi, Lara.
Hello, am I heard properly?
Yes.
Ayan. Hello everybody, how yan? Kamusta naman kayo this afternoon? I hope everybody is feeling well and very stress-free today na tungkol sa mental health ang ating topic. Let me just share my screen. Wait lang. Kita naman, no? There.
Yes, Lara.
Ayun. So, this afternoon, I will be talking about destigmatizing mental health, no, as my call to action. Pero una, tanungin muna natin, why do we need to talk about mental health at work? No? Is it not, is it not an entirely separate entity? No? Ang sagot natin ay hindi, no? They have something to do with each other at hindi ang sagot natin dahil napakalawak ng usaping mental health, no? At bahagi ng destigmatizing ay ang pagbubuwag ng mga akala o ng mga myths na makitid ito at tungkol lamang ito sa mental illnesses, no? When in fact, nakapaloob din dito ang mga aspetong social, emotional, behavioral, at cognitive, no? Almost anything that goes in the head. For example, a series of bad days due to work stress might hinder proper knowledge transfer or upskilling. Yun yung upskilling at knowledge transfer ay cognitive. Tapos yung work stress ay syempre is something na acquired sa workplace. Ayun. At we need to talk about mental health at work because of three bullets. Una, to make resources and remedies accessible and affordable. Tapos pangalawa, to increase work productivity. At pangatlo, for work generations. No? And I really enjoyed, no, and have learned a lot from the first two presentations, no, about the kumbaga, foundation setting, no, ng mga policies and, no, mga resources, no, that we have now for our mental health at work, no, and how we acquire it, no, due to occupational hazards, no. But talking about it further and destigmatizing it more would mean that resources and remedies will be made more accessible, no, and more affordable in the long run. Tapos pangalawa, work productivity. We have found out, no, that vice versa, may kinalaman ang may interaction ang mental illness at workplace environment, no? Ibig sabihin na may impact ito sa isa't isa, at actually it has direct effect, no, on each other. So ibig sabihin, what does that entail? Ibig sabihin, if we feel, no, if we feel not safe in the workplace, that might very much affect our productivity in the workplace as well, no? Tapos, number 3, for future generations. Lara, what does that mean? What do you mean future generations? Eh, di ba yung mental health, di ba self-care yan, no? Ayun, bahagi ng destigmatizing means we do not just see it, no, as self-care, no, or that it stops there, no. For future generation entails that making the spaces at home, at work, at school safe, inclusive, no, to accommodate, not really accommodate, but to be nurturing, no, for the younger, para sa future generations, hindi na tabu ang usaping mental health, no. They see the spaces, no, as very, very safe, no, for them to open up, no, for them to voice how they feel, no. For example, sa number 3, anong notorious, not really notorious, that's just a negative word, pero what institutions, no, comes to mind when we say high turnover rate? Diba? Sometimes BPOs, yes? No, and yung high turnover rate, nakakabit na siya sa pangalan o sa lunan na BPO. Isa na siyang characteristic ng BPO bilang institution, bilang places, no? And that's not how we want our workplaces to be described as, no? More so, sa workplace, and you know, we hear sometimes talaga na, no, that's fine, people come and go sa ating mga empleyado. We have heard that countless times. And you know, while that might bring some truth to it, the workplace remains as a workplace, no? And the people who came and went, no, they leave values, no, na naka-imbibe na dun sa workplace, no? Ayan. Also, according to WHO, decent work is good for mental health, no? And that poor working environments, including discrimination and inequality, excessive workloads, low job control, and job insecurity pose a risk to mental health. Ayan, this is what I mean when I said na two-way street yung relasyon o yung affinity ng mental health sa ating workplaces, no? Because we stay in the workplace for 8 hours a week, 8 hours a day, 40 days a week, no? So that's a huge chunk of our time spent in offices, spent in our workplaces. Ayun. Pero we keep talking about destigmatizing. Pero ano ba talaga yung stigma? What is stigma? Sakit ba yan sa mata? No, that's a stigmatism. Nag-joke ako. Ayun. Pero understanding stigma, no, it is when someone sees you in a negative way because of a particular character or attribute such as skin color, cultural background, disability, or a mental illness, no? It is when someone treats you in a negative way because of your mental illness, no? Yun na yung discrimination. Ayun. So, pag-ibahin natin, ano ba yung stigma sa discrimination? Una, ang kailangan nating malaman ay stigma leads to discrimination, no? While stigma is prejudice, paunang prejudice ang stigma, ang discrimination ay act upon prejudice, no? So, ang stigma, iisipin mo na, naka-declare sa PDS niya na PWD siya. I think she will not work as effectively as much as her, neurotypical peers, no? That's stigma. That's stigma kasi that's just in the head. What's discrimination is when you put into behavior that stigma. For example, because you think that napuput into action mo siya, and you put, for example, you put less on the plate of this person, na PWD, and lumalaki yung feelings niya of exclusion. Ayun. As you can see, there are types of stigma. Una ay public self-institution. Ayun. So, magkakaiba sila ng antas o ng level, no? And that what we're talking about now is the institution, no? Kasi institution ang workplace, no? And when we destigmatize, kapag binubuwag natin yung mga ganitong stereotypes at maling kaisipan, nagkakaroon nito ng epekto sa self, no? Kung saan nagkakaroon ng transfer, no, or ng positive effect yung destigmatization. Ayun. Also, bakit ba kailangan nating mag-destigmatize? Ano bang impact nito sa individuals at sa communities, no? Una, kapag hindi tayo nag-destigmatize, no, if we continue to avoid the difficult questions, no, continue to avoid the most complex questions, no, on issues, for example, like workplace flexibility, bullying, workplace politics. If we keep avoiding difficult and controversial questions, no, and refuse to take a definite stand on this, hindi makukuha ng ating mga empleyado, no, ang interventions, no, ang tamang interventions, or receive the help they need in the workplace. Ayun, kung panatilihin nating tabu ng mga ganitong usapin. Because we have to face it. It is not one person's problem only. Narinig natin sa ating mga doctors, no, na ang usaping pangkalusugan ay usaping community din. Sa katunayan, mayroong branch ng medisina na tinatawag ng community medicine. Ibig sabihin, kailangan nating maiwaksi yung prejudice surrounding mental health para maging kalahok yung komunidad sa pagsulong ng mental health. And where else to what is the better place, no? What is the best place to start it, no? Apart from our homes, syempre sa ating schools at sa ating workplaces. So ano ba yung strategies for the stigmatization? Meron tayong tatlo. Una, education and awareness. Pangalawa, workplace initiatives. At pangatlo, community outreach. Under education and awareness, meron tayong tatlong antas ulit. Manager training for mental health, no? Training for workers in mental health literacy and awareness, no? Interventions for individuals to build skills to manage stress and reduce mental health symptoms. Isa-isahin po natin. Why do we need manager training for mental health? Don't they know better? No, that's what we assume na, of course, they're managers. They know what to do. No? But, ayun, isa yun sa mga myth na i-dispel natin. No? Na considering that mental health is not really relatively new. No? Pero, it's difficult to talk about. No? And it remains to be nananatili yung awareness campaign tungkol dito dahil invisible siya na usapin, no? It's not unlike physical disabilities and physical illnesses na may manifestations, no? Na very, very apparent, no? And with that being said, ang dami ding nagtatanong, no? Ang dami ding nagsasabi na sa mga kabataan lang naman yan. Sa mga bagets-bagets lang naman yung mental health na yan. Nung panahon naman natin, wala niyan. You just walk it off, no? It's why we need manager training for mental health, no? Kasi isa din to sa mga myths na kailangan nating iwaksi o i-dispel, no? Na baka, no, and most likely, the awareness is loud and more prevalent recently ay dahil more people have been talking about it, no? And that importante, more specifically, ang manager training ngayon dahil they ought to handle or they ought to be sensitive sa kanilang subordinates, no? When for example, they are deemed to be safe people na, hey, I'm feeling this way, I'm feeling that way, no? Paano ba yung tamang response to it? Correct? Paano ba hindi paano ba hindi ma-invalidate yung aking worker when she or they try to open to me? Ayun. For example, we need manager training for mental health kasi we need to know and we need the proper skills, no, to handle and to react properly, no? Ano ba yan, Lara? Mag-react lang properly? Skills ba yon? And the answer is yes. No? We do not want to invalidate further, no, feelings of sadness, depression, no, productivity. For example, paano kapag sa ating mga managers, what do we tell? Do you know what to tell your, for example, staff when they tell you na, ma'am, sir, I have been feeling really anxious lately, no? And it's because of the city. I'm not used to city living. Manila has been very harsh and very unkind to me. Ayun. Nagkaroon ako ng anxieties, na-trigger ako kasi nanakawan ako here and there, and the traffic is really bad. What would you tell your employee? Ayan, meron tayong nagre-raise ng hand. Is it okay to...
Okay, Lara, wait a moment. Okay, Sir Lloyd Angelo Evangelista, you're raising your hand. Lara, are you okay to accommodate questions? If ever?
Sure. That's a question actually. What do you tell your workers?
Okay, Sir Lloyd, you are allowed to talk. You are on mute lang, sir. We're asking you po to unmute. Oh, okay. Baka napindot lang ni Sir Lloyd.
Ayan.
So, sige po. Balikan po natin sa Sir Lloyd later. Sige, Lara, can continue.
Ayan.
Thank you.
Ayun. So question yun, paano ba natin sasagutin yung ganong sharing, no? At ang sagot tanong doon ay you have to be trained for it actually, no? Because sometimes we might mean well, no? But it's actually invalidating, no? For example, I have been able, no, to share these kinds of things kasi yung espasyo dito sa bahay, no, has allowed me to be very self-aware and to know the difference of what, and to acknowledge feelings of invalidation. No, pag dito sa bahay nag-open ako, I feel this and that. And you know, it's just met with quiet understanding, and sometimes that's all you need. Pero for example, sa workplace ka mag-open, and your manager tells you, I know that's normal. That's how I feel too. No? And that's not a very no inclusive, no, or does not that does not make up for a very safe space when you try to open up. Yes? Ayun. Tapos, number 2, training for workers in mental health literacy and awareness. Why do we need to train our workers? Because, kagaya nga ng sabi natin kanina, usaping komunidad ito, no? At may mga bagay na pwede nang simulan sa ganung antas. Sa kaalaman po ng lahat, no? Ako po ay taga-Institute for Labor Studies at ang division ko po ay APD, Advocacy and Publications Division. Sa APD, we have tried to create an environment where we are able to open up about these kinds of things. Also, hindi man siya training, ay meron kaming coloring book. And we have snacks. We have plenty. Alam niyo ng mga dumadaan sa office na yung APD snackers, yan, madami silang snacks sometimes. No? And these are coping mechanisms, no, that we have taught ourselves na I feel sometimes better and I work better. For example, kapag may chips o kaya may popcorn, may chocolate, no, it keeps my brain energetic throughout the day. Ayun. And we need training for this para hindi man natiling informal yung ating mga available na interventions. Tsaka para ma-apply siya sa buong office, hindi lang halimbawa sa pockets of division. Ayun. Pero actually, yung snacking, nakuha ko din siya sa ibang division ng ILS. I see they have snacks, no? And, I mean, why not? Diba? Ayan. And it has proved to be helpful sometimes in stressful workplace para sa amin sa AP. And letter C, lastly, interventions for individual to build skills to manage stress and reduce mental health symptoms. So it's very long in English. What do you mean by this, Lara? I'm here to tell everyone, that emotional maturity, how you handle and you process emotions is a skill. It is not learned overnight. It is not something easy to learn at all, and bahagi ito ng tungkulin natin bilang individual na lahat ay may mental health. We have to be very self-aware. Dapat patungo tayo sa self-awareness, sometimes, when you feel something, a helpful exercise is to put a name on it. What am I feeling? Also, pag nalagyan nyo na, tapos step 2, pag nalagyan nyo na siya ng pangalan, yung inyong nararamdaman, ay tanongin nyo, what triggered this? Yes? Why is that? Why is that important? Why do we have to do that, Lara? Bakit mo kami binibigyan ng assignment ng exercise? Kasi bahagi ito ng emotional maturity that we aim to foster. Ayun. When you have emotional maturity, it means malilesen yung outbursts mo towards your workmates, towards other people, because you now see na it's not personal. And that when you process your emotions properly, and that when you are emotional mature, nakikita mo that yung feelings mo are not negative at all or positive. They're just feelings and you let them pass. For example, I'm angry and I put a name on it. Anger, I'm angry. What triggered me to be this angry? Oh, I was, for example, napagalitan ako. That's why I'm angry. It felt unfair. So, what do you do? What do you do with this feeling of anger and unfairness? Do you, for example, lash it out to somebody else? Ayun. That's the importance, Nakikita natin what to do with them, to just let it simmer and to just let it, just let it pass. Na bahagi ng ating emotional maturity ang pagiging ang hindi na pag-perpetuate ng cycle of violence. Yes? At ang magandang halimbawa nito ay For example, when you are emotionally mature and you can name your emotions, you can process it properly, you won't be able, no, not really you won't be able, but you avoid hurting people with these emotions, no? Kasi alam mo yung trigger and you know it's not personal. Tapos palalampasin mo lang, you let it simmer, you let the feelings pass. And number 3, pag lumipas na siya, but you can talk level-headedly about it na, hey, I did not like at all how you shouted at me. No, a lot of people was looking. A lot of people were looking. I was embarrassed, and it was not to me because I'm just doing my job properly. No, and that's how, ayun, sa mundo ng mga dapat, no, and sa mundo ng mga adults, it's how you process, how you do things maturely. Ayun. Tapos pangalawa, ayun, it's a skill, no? Not, and we set up people for success, no? We set up people to up their self-confidence, no? And to properly ask what they need if they have this kind of level of awareness, no? Hey, I need this. This is what I need for my mental health, for my physical accommodations needs. Yun yung letter C. We need to train for it. We need to upskill our people for it. It's a soft skill. It's what I'm trying to tell everybody. No? And number 2, workplace initiatives. Ano ba yung workplace initiatives na para sa mental health? Una-una, and you know, a lot of studies at naging premise na din to ni Dr. Reynolds at saka ni Dr. Felix na we ought to have a flexible, no, working arrangement kasi bahagi yun ng pagkakaroon ng increased control sa ating work, no? And apart from that, it was also recommended by the World Health Organizations to sometimes, you know, allow your employees to go out, yes, para hindi sila cooped up sa kanilang offices. Ayun, yun ay mga physical accommodations ba that would greatly, no, and advance their mental health, promote their mental health. Also, you know, some companies, no, ergonomically, and you know, Dr. Santa Ana can back me up on this, na they have stopped using cubicles because that alienates your person. Ngayon, ang uso na lang sa mga private institution, long table, no, or co-working spaces, no, couches, mga ganong na we deem little, no, or small interventions, but you know, push for a healthier working environment. Ayun, at ang halimbawa pa ng workplace initiative ay mga physical activity programs. No, sitting hours per day is not only terrible for your mental health but also your physical health. No, we ought to move around. Ayun. And that these are just some examples of workplace initiatives. And I'm telling you this, no, bahagi ito ng strategies for destigmatization. Kasi ang workplace initiative, according to a study, is and should be, no, promoted by the HR. No, malaking bahagi ng ating human resource sa pagsusulong ng mga workplace initiatives na ito para sa ating mental health, no, at sa health ng lahat ng kanilang manggagawa. Actually, hindi lang mental health. When we say physical activity, physical activities, no, it encompasses, no, lot of aspects. Halimbawa, marami kayong lalabas, that's already social. Magko-community outreach kayo, number 3, that's community, social, mental health, no, environmental already, and physical, because you were able to get some booking done, yes? Ayun. And lastly, community outreach. Number 3 is I have to admit, a little bit difficult. No? But the good news is, it's not impossible. We start somewhere, for example, education and awareness, and we progress hanggang makarating tayo ng community outreach. Because, you know, because, you know, once sa office, pag hindi na ma-contain ng office niyo yung awareness that they have, no, the feelings of, hey, everybody should enjoy what we're enjoying in terms of health, mental health. no? Magkakaroon ng spillage, magkakaroon ng overflowing of it. And I hope everybody enjoys this, no? I hope we can share to other offices nearby na it's very good na they go out once in a while, no? To plant trees once in a while, to visit someone sick, a friend in need. Yes? Ayun. Kaya, ayun. But the community outreach, number 3 siya. Kasi may mga antas pa tayong kailangan i-fulfill. No? If we want community outreach to be effective and efficient, we must first, learn how to, for example, use the proper language. Kasi dadating tayo sa community, hindi tayo educated and aware enough. Makakagamit pa tayo ng mga demeaning words kagaya ng retarded. You know what I mean? So it's a process. Everything is a process. And we're in no rush, but we have to start now, is what I'm trying to tell everyone. So ano ba yung call to action ko sa pagtatapos? Sorry. Oops. Ayan, ang call to action po ay encouraging advocacy. I encourage everyone, not force, definitely not force, everyone to engage and to start conversations on mental health and stability, regardless of discomfort. Because we have to admit it is sometimes uncomfortable. For example, disclosing your what do you call it? Yung mental illnesses that you have, for example, it requires a lot of courage, and there are many risks to it, kasi we are allowing ourselves to be open for scrutiny. And today, in this very accepting space that we have created for ourselves, we recognize that not everyone can afford it. Yes? Bakit ako? Why am I allowed? Why do I have bakit ako allowed, or why can I afford to speak up about this? Because unang-una, at home, dito sa bahay, is a very safe space na I'm able to extend this kind of understanding to everyone, to talk about it. And pangalawa, I am getting help, I am getting the help that I need. That's number 2. Ayun. So, we recognize that talking about this right now, in this day and age, is also a privilege, that we do not, na hindi natin hinaabuso, or not, na hindi natin ginagamit selfishly, because we want everybody, to we want safety, for everybody, not only physically but mentally. Safety to the point of them being able to tell you how they feel, and that this feeling, and we also recognize everybody's intelligence, self-awareness, to tell the managers and supervisors what to do with these feelings. Hey, this is what I need. This is the accommodation I need. Ang tanong na lamang ay gaano tayo mag-meet sa middle? What can we offer and what can we receive in terms of workplace policies and workplace initiatives? Ayun. Anong training ba at kailan ba ito available? Para ma-upskill tayo sa mga ganitong bagay. Ayun. At number 2, positive communication. This is the last na. I admonish everybody, to be very, not to only encourage not to encourage advocacy of mental health, but I also encourage everybody to be very kind and very positive in the way they talk about it. Ayun. Because it matters, no? It matters to everyone. And not only that, no, positive communication allows for inclusive spaces na, hey, I know Lara, paglapitan mo yan, she'll just validate you. That's the kind of person that she is. No? Pwede mo siyang lapitan about it. She's very open to hearing your problems, no? And you will not be met with judgment. That's the kind of people we want to be, yes, no? Safe na ang espasyo ng institutions, ang offices, ay gawing safe sa pamamagitan ng pagkakaroon ng mga tao din na safe. Yes. Ayun. At bilang aking parting words, yan, just to, para makapunta na tayo sa open forum. There is this female poet that I really like, si Mary Oliver. You might know her kasi ang type of poetry niya is very about animals, about flowers, and nature. Ayun. And there's this poem, no, na Wild Geese, tas ang unang line doon ay, you do not have to be good. Lara, sasabi mo lang po is positive communication, tapos ngayon sasabihin mo, you do not have to be good. What does that mean? You're very confusing at times. And what I mean by that is, there's so much pressure, there's so much unkindness, unruliness, no, that allows us, no, that parang warrants us to be the same of unkind as well, the same of rudeness as well, na ang daming avenue or paraan para maging hindi na lang mabuti or maging unkind. Kagaya ng sinabi ni Mary Oliver na you do not have to be good. Ayun. Pero I know, and today I'm validating everyone that you are anyway, you're good. And if you're not good that day, that's fine as well. What energies, no, anong kaya mong expend today, and that's your best. Good for you. I'm still so proud of you. And you do not have to be good every day. Yes? No? And that's fine. That's okay. Yun lang naman po. Thank you very much, everybody.
Ayan, so there you have it. Thank you very much, Lara, no, for the very empowering message to support mental health advocacy in the promotion of its awareness in the workplace. No, we really appreciate how you discuss, no, how we can destigmatize mental health issues in the workplace, and also kung ano-ano yung pwede nating strategies coming from the ILS Employees Association, no? So, maraming magagandang bagay na sinabi si Lara. So, maybe we can start from there in doing our initiatives and these advocacies in our workplaces. And indeed, we have seen from our presenters that we are taking many steps, no, and initiatives to really promote mental health in workplaces. Our government has a lot of initiatives, and we are pushing for more. So it is really a venue for us to really discuss this specific issues that are really timely and relatable to our workers. So thank you, Lara, and see you at the open forum later. So at this point, let us acknowledge the presence of our attendees via Zoom and those tuning in via the ILS official Facebook page. Thank you very much for gracing this event. So we have attendees coming from the MMDA, Office of Civil Defense, schools such as the Polytechnic University of the Philippines, University of the Philippines, Leyte Normal University, University of Makati, and of course we are some attendees from DILG. And we have comments from our Facebook page, no? So let me read these for you. So comments from Facebook from Yes Prado. A safe space in this institution starts with how managers set up their workplace. So thank you, ma'am, for that comment. Another from Sir Paul Boller. Positive communication is crucial in breaking down the barriers associated with mental health, reducing stigma, and creating an atmosphere where employees feel supported and understood. It contributes to a workplace culture that prioritizes the well-being of its members and fosters a sense of community. There you have it. And now it's time for our open forum. So now we are opening the floor to questions. So as we can see here in our platform, we have a number of questions coming in from our attendees via Zoom. So we will accommodate as much as number of questions to manage our time. So should we exceed, we will document the questions and forward them to our speakers. So answers will be sent to your respective registered emails. For those Zoom attendees that are able, kindly put your questions in the Q&A portion of the Zoom. And for those who are able to raise their hand, we can also allow you to talk. So let's now move on to the open forum. So can we put in spotlight our presenters for this afternoon's webinar for the open forum, please? So some questions, not necessarily direct to one presenter. So any of our presenter for today's webinar can answer. So for the first question, from Sir Corpus, how can we determine if an employee is crossing through the thin line of mental health sickness, real and behavioral issues such as controlling and narcissistic, as you said, that we need to validate our employees' emotions related to what you will do if your employee confides to you about their anxiousness? So anyone from our presenters?
Hey, Michelle.
Ayan, Doc.
Doc Felix.
Yes, Doc.
This is Doc Felix.
Yes,
So,
Doc Felix.
yeah, from the policy maker's perspective, if one of your workers decides to confide with you regarding their mental health status, their mental health condition, and for example, you are a co-worker, what are you supposed to do? In this particular instance, the Department Order 208 specifically provides that there should be a policy and program or a guideline through which everyone would be appraised on what they need to be able to do. Parang situationer, nag-confide sa'yo, anong gagawin mo doon sa information na yon? And that is spread usually through the awareness raising campaign. Bakit kailangan nating alam to? Kasi if if nag-confide sa akin na gusto niyang magwala, gusto niyang maging violent because of the level of stress na meron siya, am I morally obligated to tell my boss? Am I legally bound na pag merong gustong manakit, merong gustong bumaril sa isang coworker, am I legally bound na magsabi tungkol dito without breaking confidentiality? Ang ating po kasing policy and program is not just about a set of words giving instructions. It's actually giving direction, at nagkakaroon po tayo ng brainstorming nito along with the Occupational Safety and Health Committee. Ang OSH Committee po natin ay binuo po noong ating Occupational Safety and Health Standards na pinablish noong 1978 pa. Ang composition po ng OSH Committee is the OSH personnel, the management, at saka yung employee representative. So yung inyo pong policy and program, pag-iisipan nyo, paano pag ganitong sitwasyon? Isusulat nyo. Pero ito po ba ay nagbabind? Tatanungin nyo sa legal. Do not put yourself in a situation na merong nag-confide sa inyo, hindi nyo alam ang gagawin kasi pag tinignan nyo yung guidelines ninyo, kinapi-paste nyo lang kung ano yung nakasulat sa DO 208-20 na parang sinasabi nyo, the establishment shall do this, the establishment shall do that. Oo nga po, instructions namin yun sa inyo. ano ang gagawin ninyo, because there's a line between this is my instruction to you, how are you going to implement it? Yun po yung content ng policy and program. Kaya po yung sinasabi ni Doc Ray kanina na mayroon pong available na parang workshop on how to write the policy and program. Kung kakayanin nyo pong mag-avail nun, please avail it. Kasi iba po yung sinusulat ninyo and ini-implement ninyo. If something that you're writing is not implementable, then it's just good in paper, but it's not actually good in practice. Kaya yung sagot dun sa tanong kanina, may nagsabi sa akin, anong gagawin ko? Ang susunod na tanong ko, anong sabi sa policy ninyo? Anong sinabi dun sa awareness raising ninyo? Because it's not always the same. Depende kung ano yung sinabi. Kasi if I'm anxious, gusto kong pumatay, legally ba meron bang nagbabind sa akin? Yung mga lawyers po natin, makakatulong po yun sa pag-aasikaso nito. Kasi there are certain human rights conditions that should not be violated, even if may mga sitwasyon. But tulad nga po na nababanggit, even dito sa amin, sa Department of Labor and Employment, safety and health is the highest level of priority. Kumbaga, wala ka nang iibababa pa doon. Kaya kapag ang isa ay dangerous na, ano ang susunod mong gagawin? Yun po ang guiding principle na. Thank you. This is from the policy point of view.
Yan, thank you very much for the comprehensive answer, no? From Doc Labanda Jr. So, apart from the question on policy, no, merong related question on policy po tayo here on our Zoom from Ms. Hagi. Ang question na po ay, is there a sample policy in the DOH which has also capacitated mental health program other than our DOLE?
Sa DOH po, Ray, meron ba? Policy and program. Yung guidelines po natin kasi lalo na po pag workplace, ang sinusunod po natin, syempre yung DO 208-20. Kung nagtatanong kayo kung may guidance si DOH, nagbibigay po siya ng guidance na yun naman ang sinusunod ni DOLE. Diba? I'm not sure lang sa Occupational Safety and Health Center how you're approaching this. Can you
Thank you, Felix. No, with OSHC, same din po, no. Kasi we are under the umbrella of DOLE, so we are bound doon din sa policies natin. Pero sa DOH, meron silang mga capability building internally, no? Siyempre to capacitate themselves para pag capacitated na sila, ika-capacitate naman tayo. Ika-cascade yung mga natutunan nila at mga na-acquire nila through training, no? Sa atin naman per institution din. And also they invite yung mga agencies in which DOLE participates in, di ba Doc Felix, no? Kasama rin tayo doon sa mental health DWG, no? Kapag meron silang training, they invite DepEd, DOLE, and other agencies to be part doon sa capability building din. And sa part naman natin, kunyari sa DOLE tayo yung nakapacitate and tayo yung naging participant ng DOH, tayo naman yung magiging responsible on downloading yung mga natutunan natin doon from DOH para streamline tayo, no? Nag-iisa lang yung ating thought and yung nais ng DOH na gawin since they are the prime experts in health, diba? Department of Health. So we follow what they say and they recommend, diba? Yun po. Thank you.
Okay, thank you very much, Dr. Santa Ana and Dr. Felix Labanda. So, nakita natin no on how we can harmonize all these mental health policies. As a related question, I'm not sure if this is a private institution or development partner. From Sir John Conrad Carlos, are there any sample policies for government institution we can also follow for our institution? I'm not sure lang po if this if it's coming from the private sector or the public sector, but if Dr. Felix Labanda can answer this one.
Yeah, I saw this question a while ago and actually medyo naghanda ako ng bahagya Oo, dito sa tanong ni Sir, ano po, I'll just share my screen. Ito po is from, you can see on your screen, this is actually the basic policy and program outline. Kumbaga, ito yung tinitingnan natin, ano yung component kapag gumawa ka ng policy and program. Sir, papicturean na lang po. In terms of, ito ba ay sa private, ito ba ay sa government, meron naman na pong nilabas na joint memorandum circular. So just stop sharing na ha. Meron naman po tayong nilabas na joint memorandum circular with DOLE, CSC, and the Department of Health regarding occupational safety and health in the public sector. Ang prime mover po nito or ang person responsible or agency responsible is the Civil Service Commission. Kasi syempre ang mandate ni DOLE is for private establishments, ang government kay civil service. However, may caveat po tayo because we have UH retained hospitals as well as government hospitals and health facilities. Ang mga ganun po ay usually napapaloob under the Department of Health. So usually ang tinitingnan niyo po is the Disease Prevention and Control Bureau. Ang policy naman po, halos iisa lang po ang tinatakbo niyan eh. Ang pagbabasihan nyo lang simula pa lang ay RA 1136, the Mental Health Law. Very, very clear tayo dyan. Susunod na pagbabasihan nyo dun sa inyong isusulat sa policy, implementing rules and regulations released by the Department of Health. Sabihin mo, Doc, kami ay DILG. Applicable ba yan sa amin? Yes. Because the DOH released the implementing rules and regulations for the particular law, which is RA 1136. Given that, yung mga nuances na parang, sa amin ganito lang ang applicable, then that's what you write. That's what you implement. Halimbawa, masyado ng maliit, barangay level. Ito pa rin ba ang gagawin namin? Siyempre babaguhin nyo. That is the beauty of policies. It is subjected to whatever you have. Kaya po, sa amin po sa private sector, ano yung tinuturo natin sa DOLE, under the Department Order 188-18, meron po tayong tinatawag na hazards identification, risk assessment, and control. Kung ano po yung hazard na nasa inyo, kung ano yung risk na nasa inyo, yun yung gagawa nyo ng control. Hindi naman po kayo gagawa ng tulay sa lugar na wala namang ilog. Diba? So yun po yung context po natin sa mga policy. Kailangan po, meron kayo laging knowledge base, kumbaga. Yun yung ine-emphasize natin eh. Yung binanggit ko kanina, which is the policy, yung binanggit ni Doc Ray na may kinalaman sa how you're going to implement it in the workplace, and yung binanggit ni Lara kanina, kung paano nyo lalagyan ng puso ang inyong policy, is actually the entire thing. Do not create a policy that is not human-centered. Yes, we have laws, but you always consider sino yung mga actors nito, sino yung mga tao na involved. Kasi if you have a policy and program that is based solely on the law, without any consideration on the feelings of people, medyo magkakaroon kayo ng samaan ng loob. Because we always go back to the wisdom of the law. The law is always there to protect people. Hindi po siya para manikil ng karapatan. And hindi rin siya nandoon para sabihin na ikaw identified kita. Kasi marami po akong natuturuan na tinatanong ko, kapag may mental health policy and program po ba kayo, magi-screening po ba kayo o hindi? Ang most often than not, ang sinasabi ay magi-screening po kami para matulungan namin sila. And I always return na, bakit? Nanghihingi ba siya ng tulong? Self-realization is critical in mental health. Kung ayaw ng tulong, huwag niyong ipagsalaksakan ang sarili ninyo. And mental health screening opens up the probability of stigma and discrimination kasi actively hinahanap mo siya. Anong gagawin mo dun sa information? That is where policy and program comes in. Kung wala po kayong gagawin sa information na makukuha nyo, huwag nyong hahanapin because it opens up avenues. Thank you.
Yan, thank you very much, Dr. Labanda. No, malinaw yung sinabi ni Dr. Labanda for that specific question. So another from our attendees, no, ito yung question na to medyo marami nagtatanong, no, from Ms. Lozano Natividad, are there a list of specific mental health issues or illnesses to be considered a person with disability or PWD? I think this is one of the questions na marami ang nagtatanong, no? Ano ba, paano ko ba masasabi na pag may mental health issue ka, you will be considered as a PWD? Ayan. Anyone from our roster of speakers today?
Hello. Baka ba yung mic?
Hi, Lara.
Ayun, hello.
Mm-mm.
Yung para maging PWD ka, mali nga yun eh. Hindi ka naman nagiging PWD. You do not work towards it. You were diagnosed as. Yes. No? And that yung card na PWD, it requires a diagnosis from your doctor, no? And siguro I chose to answer this question para lang i-reiterate yung sinabi ko na una na, for example, you might not be hindi ka PWD, no? But you're feeling very stressed, agitated, no? Na bahagi pa rin yun ng usaping mental health. And you don't need PWD assessment or cards, no? To validate what you feel, no? For a certain period of your life. Ayun lang naman. Na if you're stressed at that particular moment in time because of your workplace, because of your workload, that's mental health, that's usaping mental health pa rin yun, and it's very, very valid. Yan. You don't need a diagnosis, no, to validate you. Although, doon sa mga nagtatanong ng diagnosis, if you suspect yourself to be with a mental illness, alam kong at bahagi ito ng advocacy ng mga mental health advocates, no, na para na it's expensive, pero if you feel the urge, or if there's a high need for you to see a doctor for treatment, syempre I highly recommend that, and I encourage everybody.
Thank you very much, Lara. From Dr. Santa Ana or Dr. Labanda, if you have other inputs po to the question.
Yes, Michelle. I
Yes.
think yung in order for you to have that PW card, no, yung parang psychosocial disability yun eh, yung PW card na yun, no. And syempre, may mga requirements yun sa City Hall, and one of the main requirements yung dapat na diagnose ka ng psychiatrist rather, di ba? And other assessment tools and mababack up natin yung mga diagnosis under psychosocial disability. I think may ano ba yung mga yon? Mga long-term na mental and behavioral disorders or problems yung belonging under dun sa psychosocial disability. Parang bipolar, schizophrenia, recurring or long-term depression, epilepsy yata, ADHD, and such. Yung mga ganun, no? And may mga iba pang mga diseases, no? Pero it all boils down sa decision ng psychiatrist and diagnosis niya. Depende sa assessment ng psychiatrist doon sa worker, no? Hindi tayo magsasabi na ay depressed ka kasi malungkot ka, kasi ganito pa. Ay bipolar ka kasi masyado kang malakas tumawa, sobra kang nagmumukmok diyan. Hindi gano'n, no. Merong objective assessment ang mga clinicians natin, specifically psychiatrists, in order for you to be diagnosed as such and avail of to be under dun sa para masabi na disabled ka psychosocially, and para magkaroon ka ng PWD card, no. Yun po. Thank you.
Yes. Yes, Michelle, idagdag ko lang, no, doon sa mga binanggit ni Lara and ni Rain. Importante, syempre policy na naman, doon ako magbabase. Doon sa Labor Advisory 19, nakasulat na doon yung mga numbers na pwede niyong tawagan. Now, kung gusto niyo mag-avail kasi ng PWD, kailangan meron muna kayong self-realization. Meron ka nga ba o wala? Do you need help? Kasi hindi pwede na, halimbawa ako, may salamin ako. Qualified na ba ako maging PWD? Baka hindi naman malala. And I'm actually able to handle it. Gusto mo bang magka-PWD kasi alam mong marami kang gagastusin? Kasi yun yung purpose ng PWD card, diba? Marami kang gagastusin, marami kang kailangang gamot na bilhin. or gusto mo magkaroon ng PWD kasi meron kang 20% discount sa lahat. Kailangan alam mo kung ano yung dahilan bakit mo gusto magkaroon ng PWD card. Because the purpose of the PWD card is to be able to help you because you're going through something that is very difficult. And for you to be able to say na you're going through something difficult, meron kang matatawagan na number. You call the number, sasabihin nila sa'yo, ay sige po, mag-consult tayo, mukhang kailangan nyo. And then eventually, magkakaroon ng management na para makabalik po kayo sa work, ito yung kailangan nyong gawin. Iinumin nyo po ito habang buhay. Pasok na doon sa sinasabi ni Doc Ray na, hindi pala ito, parang sinipon lang ako, may PWD card, na hindi po ganun. A mental health condition once realized and once identified na ito pala ang sitwasyon, this is genetically determined, there is there's a trauma before, na nag-dispose further nito, yun po ang magti-trigger sa inyo na lifelong na ito. Doon nyo po makukuha yung certificate galing sa psychiatrist or psychologist. Huwag po kayong pupunta sa psychiatrist na, Doc, magpapakonsulta po ako kasi kukuha po ako ng PWD card. Huwag pong ganon. Magpapakonsulta po kayo para gumaling. And then eventually, if you feel na masyadong maraming magiging gastos, habang buhay pala to, Doc, pwede ba akong pumasok as PWD? Doon lang po siya papasok. Hindi po the other way around. Unahin muna natin yung sakit bago yung benefit. Okay? Thank you.
Okay, thank you very much, Dr. Labanda. So, while we're on the subject, I would like to take this opportunity kasi marami tayong questions na nakukuha from our attendees. So, you've told us about the we might need to seek professionals. So, from Sir Raymond Salagumba, are there any agency or group of professionals who can recommend to individuals who might need to seek professional help regarding mental health? And another, for agencies that can request a speaker regarding mental health. We are just small entity. We want to have an awareness with our employees. I'm not sure lang po if this is a private or public sector group. Ayan, sige. Dr. Felix.
Sorry, ayan, ako sasagot yan kasi I recently had the technical working group meeting with those that are willing to provide. You just have to go to their website. Pag sinabi po natin na mental health or yung ating pong batas, RA 11036, ito po ay hindi lamang psychiatric. This is also neurologic help. So yung mga nagsiseizure, yung mga may epilepsy. So for mental health in terms of psychology, ang Philippine Psychological Association, dun po sa website nila, meron po nakalagay doon na contact us. You can email them. Pwede po sila mag-render po sa inyo ng service. Pwede po sila mag-provide ng talk. Kahit saan parte po ng bansa, sabi po ng presidente. Pero kailangan mag-schedule kasi nung mula po na lumabas yung batas, sobrang dami po nagpapaschedule sa kanila. And of course, syempre, nandoon din po yung kailangan nilang i-prioritize yung mas maraming participant. Kasi yung iba, nagpapatok pero 10 lang yung attendees nila. Di syempre medyo mas kailangan nilang i-streamline. And then for those that are seeking for yung brain health naman, halimbawa yung stroke, seizure, mga anything na related sa mental health pero brain naman yung parang brain mismo yung may problema. The Philippine Neurological Association is open daw for communication. Nandun din sa website nila yung contact us nila. Puntahan nyo na lang po. One is the Philippine Psychological Association and then the other one is the Philippine Neurological Association. Yung Philippine Psychiatric Association, hindi ko pa sila nakausap. So hindi ko sila makommit. But the two, the Philippine Psychological and the Philippine Neurological, willing daw sila, mag-email lang po kayo. Thank you.
Ayan, thank you very much Dr. Felix for giving us yung ating mga professionals where we can seek help lalo na dun sa ating mga struggling workers. So we've discussed about yung sa individual problems regarding mental health. Balik naman po tayo doon sa mental health sa ating workplaces. So we have questions on how we can cope sa stress sa work. So meron tayong mga ilalam ko na lang yung mga questions because may pagkakahawig yung kanilang mga itinatanong. So from Miss Alumbro Chavez, What can we do against a manager that gaslights an employee struggling with mental health? Another from Ms. Bebera. What do you do if the number one stressor is someone of great influence that the others just grit and bear? And another from Miss Bell Aspiras, in case of unavoidable circumstances, what are the best remedy on how to avoid a mental breakdown within the office by not showing to co-employees that something is wrong? So anyone from our panelists?
Isagutin ko
Lara?
yung kay Ma'am Bell Aspiras.
Okay.
Ang tanong niya ay unavoidable circumstances, no? Best remedy to avoid mental breakdown within the office. Unang-una, if you're not allowed, if you do not deem it comfortable to break down in front of your coworkers, that's fine. That's up to you, no? You can do it in the restroom. Pero pangalawa, if hindi open yung office nyo to witness such kind of mental breakdown na malamang ay shared experience naman lahat, what does that tell about the workplace, no? Or what does that tell about your coworkers, no? At ang pangalawa at ang next point ko ay don't avoid mental breakdown. Just go through the motions of the mental breakdown. If you want to cry it out, you know. If you don't want to do it in the office, that's fine as well. Pero it's a valid feeling that you have to go through. Ayun. Kapag tapos ka na, again, anong trigger ng mental breakdown? Kasi most likely, hindi siya isang bagay lang that caused you a mental breakdown. It might be a series of things leading up to it. So pag nakita mo, stress the next. Pag nakita mo, pag tapos ka nang mag-breakdown, tapos nag-assess ka na, nakita mo na, nung Monday ganito, nung Tuesday ganito, nung Thursday ganito, makikita mo na it was a natural reaction from yourself, no, na probably very tired from work. And pangalawa, makikita mo na how to avoid it, no? Or that maybe address the trigger para next time, no, ma-lessen yung mental breakdown. Pero ayun, sana bilang advocates, no, ng mental health, we want the offices, no, to be very open, no, or to be very accommodating, no, to have spaces for breaking down, no, to have your people in the office na would listen to you, let you finish to cry it out. Yan lang naman po.
Ayan. Thank you, Lara. From our other panels sa ating mga doctors, any comments po?
Muna before si Doc Ray. Kasi sa kanya implementation part na eh. Sa akin, syempre babalikan ko yung isa sa mga tanong kasi what if yung manager mo yung nagkakos sa'yo ng stress, no? Kailangan natin balikan yung inyong policy kasi ang mental conditions in the workplace, marami po kasi siyang factors leading to it. It may not be just the workplace alone. Pwede kasing may community involvement. Pwedeng galing siya sa stress sa bahay na nadadala lang sa workplace. So kailangan merong pag-iisip itong si worker, saan ba nanggagaling yung stress niya? Kasi pwedeng additive lang eh. Pwedeng ang stressful talaga ay yung bahay, tas dumagdag yung work. Kaya ngayon, usong-uso yun, huwag ka nang dumagdag ha, ang dami ka ng problema, dumadagdag ka pa. Kasi ibig sabihin, nare-realize natin where the problem is coming from. So, kumbaga mag-root cause analysis tayo ng sarili natin. Saan ba ito nanggagaling? Pero there's also sometimes there's this overwhelming fear of a boss or a manager, or there's this overwhelming emotion na kapag itong manager na ito ang kausap mo, parang gusto mo nang wag na siya magsalita, susuntukin mo na lang. Parang ganon. Kasi may combative or may aggression ka na agad. Ang perspective na lagi nating gustong i-push is, ito ba ay personal o ito ba ay something related to work? Kasi halimbawa, budget hearing ngayon. Tapos maraming hinihingi sa'yo. Ang daming dapat gawin mo to, dapat matapos to, dapat matapos to. siya ba talaga yung nagpupush sa'yo? O dahil the situation demands that every one of you goes home at 10 p.m. because tomorrow ay budget hearing na at budget deliberation na ni Dole. Kumbaga, halimbawa, nakasalang kasi si Dole yesterday. So, hindi mo pwedeng sabihin na dinidikdik niya ako, pinipersonal niya ako, when in fact, yung hinihingi sa'yo ay hinihingi rin sa kanya. Diba? It's nothing personal. It's something that's demanded by work. So you have to identify, work ba to or hindi. But, doon po sa awareness raising ng ating pong mental health, kapag lahat po tayo ay umaattend ng mental health awareness raising, alam natin na ang isang tao na mukhang walang tulong ay meron palang pinagdadaanan, meron kang recognition. The earlier we recognize a coworker that has a mental health condition, mas mabuti. Kasi sometimes, you being the patient, being the service user, you don't know. Yun po yung nature kasi ng mental health condition. There is something, like for example, if I have anxiety, I know I am anxious. I'm not sure why. I know I am anxious, but I cannot control it. And sometimes it's the coworker that recognizes it. So, yung awareness raising, wag lang po kayong a-attend dahil may libreng merienda. Makinig po kayo kasi yun po yung essential para mayroon po kayong recognition. Ayan. Thank you.
And thank you, Doc Felix, Doc Reynolds.
Yes, no, Michelle, no. In relation din sa kadagdag dun sa sinabi ni Doc Felix at ni Ma'am Lara, no. Our thoughts dictate how we feel. So, syempre, kung ano yung pumasok sa isip natin, magta-translate na yan into our feelings, which is negative na. Kung negative yung experience at na-perceive na natin dun sa particular event na yon, no? And matatranslate na yan sa behavior. Kumbaga, na pumasok na sa katawan natin yung nega no? Pero if we can control, kasi ito, we cannot control lahat. We can only control ourselves and how we react doon sa situation, di ba? So, what we can do kahit sa sarili natin, though mahirap, and it entails practice, no? We change our perspective, di ba? And we understand a little more, be more understanding doon sa situation, no? Like yung sa sinabi ni Doc Felix, no? Ano ba ito? Talaga bang ganyan talaga siya? Yung ugali ba niya? Or nape-pressure lang ba siya? Kaya tayo niya pine-pressure, di ba? Parang ganun. So, kung work yon, maintindihan natin na, kaya pala siya ganyan, no? And maintindihan natin kung saan siya nanggagaling, ano yung hugot niya, ano yung pinagdadaanan niya, no? And yun, we understand na pag nasabihan tayo, at least hindi ganun kalakas yung impact. Kasi parang, I understand him, her, kasi kailangan ng ganito. So, sige, gawin na natin yon. Yung parang ganun siya. And it lessens yung burden na dadalhin natin, no? And it will lessen din yung risk, no, na ma-develop tayo ng mental health conditions. Plus, ma-develop yung ating resiliency. Yun naman talaga yung dapat nating i-develop yung to be resilient dito sa mga ganitong mga stress o external stressor sa buhay natin, no? Kahit ano naman ang sabihin niya, kahit murahin ka, kung resistant ka, resilient ka, naintindihan mo yung situation, hindi ka matitinag di ba? Yun. Parang may mga kasabihan nga yung sa bangkang papel or barko, kapag pinasukan ka ng tubig sa loob, lulubog ka na. Parang yon, huwag nating hayaan na makapasok yung tubig doon sa barko natin. At kung hindi, lulubog tayo. Yon. Plus, aside doon, no, meron din tayong policy at meron din tayo, yung DOLE policy na mental health. Ang aim niya is to become, to make our workplaces hindi lang safe and healthy. To also be mentally healthy as well, di ba? Meron na tayong advocacy doon, so increasing awareness, no? Kung pinopromote natin ang mental health sa workplace, we should go by the example, no? And pag marami na tayong, or pag natutunan natin kung ano ang mental health, yung signs and symptoms niya, maintindihan natin at maunawaan natin kung ano ito at ano yung mga kinikilos at behaviors ng mga kasama natin sa trabaho. And alam natin at marirealize natin na meron tayo iba-ibang personalities na ganun siya, ganito ko, pwede kaming mag-clash dahil sa miscommunication at misunderstanding. Yun. And we have to live with it kasi iba-iba talaga tayo individually. May iba-iba talaga tayong personalities. Plus, doon sa policy natin, pag natuto tayo, na-promote natin yung mental health, maunawaan natin, tataas yung insight natin about mental health. No? It will increase understanding of ourselves and coworkers. It will, syempre, increase compassion, reducing stigma eventually, and discrimination. Magkakaunawaan tayo doon at dadagdag yung pasensya natin with each other. Yun. Tapos, aside do sa policy, meron tayong company rules and yung code of conduct ng behavior natin, di ba? Sa workplace, dapat ginagawa natin yung professionalism na behavior, di ba? Kasi though hindi siya written or written siya sa policy, we should also conduct it at the best of ourselves kung nasa workplace tayo. Meron tayong mga certain code of behaviors na appropriate dapat sa workplace. And yun dapat yung itatry nating gawin doon sa workplaces natin. Yun lang po. Thank you po.
Ayan. Thank you very much, no, Dr. Ray. So before we go to the last set of questions, no, we would like to inform our attendees that for those questions that we cannot accommodate, you can email us at apd@iles.dole.gov.ph, and we will forward your questions to our respective speakers today. And we are also on live via our official ILS Facebook page. And you can also rewatch or share the whole webinar to those interested, to those would like to know how to craft your respective mental health policies, or specifically on mental health in general. So with that, while we are on the subject of mental health in the workplace, so our last set of questions will discuss on how we can equip naman our management in dealing with mental health issues at the workplace. So we have a question from Ms. Maria Corazon Caritativo of the National Wages Productivity Commission. Ang sabi niya po, productivity and mental health have a close relationship. When mental health is negatively impacted, it can lead to decreased productivity, increased absenteeism, and presenteeism. It's important to have support systems in place for workers or employees who may need immediate help in the workplace. Should we consider creating a group or program within our respective workplace to address this immediately? Yun po yung first question. Another related question, how can managers be better equipped to support employees with mental health conditions? From Sir Paul Christian Fowler. Are there specific training programs or resources that you think would be beneficial for managers in addressing mental health issues? So anyone from our panelists today?
Sige, ako na. Mahaba kasi ako sumagot eh.
Sige pa, Dr. Felix.
So yun sa question ni Sir Moller, if you're thinking about capacitating yourself, yung binanggit ko kanina ng mga organizations, it's a good place to start. And then you can contact the Occupational Safety and Health Center para po dun sa capacity building din. Pero ang hinahanap nyo kasi is managers managing people and knowing what they need and knowing what their wants are. Hindi po ito trabaho ng isang tao. Trabaho po ito ng isang organization. This is a culture. Kasi kung mag-isa lang po kayo, or halimbawa, 3 kayong manager, di lahat kayo nakapacitate. Pero yung boss ninyo, kasi manager kayo, meron pang mas mataas sa inyo, the boss does not understand. The boss does not listen. the boss ay walang pakialam. Wala ring silbi. At the same, on the other end of the spectrum, kung lahat ng mga nasa executive committee, lahat ng managerial level pataas is informed, is very much into it. But the workers, the rank and file does not care. Or is not, ang inuuna nila, ang baba ng sweldo namin, ang dami nyo pang binibigay dyan na mga mental health. Unahin nyo muna yung bulsa namin. May mga ganong kasing sitwasyon. Yung priority nila is yung pang-araw-araw na pagkain. Sometimes you have to find the perfect spot where you have to start. Kasi katulad po na nabanggit ko kanina, ang na-realize po namin sa Technical Working Group ng Philippine Council for Mental Health, there is so much linked to mental health conditions na hindi nyo siya pwede ma-address all at the same time. Ang mental health condition po is not a stand-alone policy. If you would notice, ang HIV and AIDS in the workplace has a component of mental health. TB in the workplace has a component on mental health. Meron din po tayong drug-free workplace. May mental health component din po ito. So if you're thinking of mental health as something that is stand-alone and something that you must be good at, then you definitely must be good with all others. So yung approach po natin is form your Occupational Safety and Health Committee properly, review your policy, align it with existing laws, and then determine each and everyone's capacity, and then you start from there. Huwag niyo pong iisipin na there is one single direction for which you want to approach mental health. Kasi po kung kayo ay ospital at ang priority nyo ay treatment ng work ng mga pasyente na may mental health condition, does that make you the expert in preventing it? Baka hindi. So kailangan meron po tayong iba-ibang levels ng prevention, primary, secondary, and tertiary. Kailangan po at the end of the day, ang isang manggagawa na nagkaroon ng mental health condition ay naibabalik natin sa pook paggawa. If a worker suffers a mental health condition and is taken away from the workplace because nagkaroon siya ng anxiety, natakot siya sa stigma and discrimination, then we have a failing program, even if nagbibigay ka ng maraming pera. Right? Thank you.
Thank you very much, Dr. Felix. So are there any other answers po from our panelists to those specific queries from our attendees? Meron pa po ba? Ayan, so hearing none, no? Before we conclude this open forum, we would like to ask each of our panelists to give us your parting words naman po for this specific topic on promoting and advancing mental health awareness in our workplaces. So sino pong mauuna? Ayan. Lara, ayan, si Dr. Ray? Dr. Ray?
Ako na yung unang nag-unmute. Okay. So in relation dito sa ating webinar, no, particularly doon sa mga topics natin, importante muna na malaman yung mga triggers natin in mental health, yung mga factors natin. Ano mga triggers natin kung bakit tayo nagkakaroon ng mga risk na ito on mental health. I-identify natin yung mga psychosocial factors sa ating mga workplaces, no? Parang una muna mag-risk assessment mo, hazard identification and risk assessment. Ano ba yung mga nagtitrigger sa mga kasamahan ko sa trabaho with all kinds of factors? Hindi lang ito psychosocial din na maapektuhan, na ma-identify natin. Lahat ng aspeto sa wellness and well-being ng tao, it can affect mental health natin. No? And mas maganda ma-target natin in crafting your policy yung aspeto ng wellness kasi as defined sa WHO, di ba, sinama doon ng wellness, buong aspeto, spiritual, ano pa, physical, di ba, emotional, economic, and other things, no, na ma-define ang person or ang isang worker as an individual being, no? Yun ang unang-una muna nating dapat ma-realize and malaman, no? And from there, makaka-develop tayo ng mga appropriate interventions, no? para targeted yung ating approach, no, in dealing with mental health problems, no. And also, like yung katulad ng sinabi ni Doc Felix, no, walang one way approach ang mental health kasi it encompasses well-being. So, di ba sa drugs, meron TB, HIV, meron. Tapos kanya-kanya meron tayong mga policy respective to those department orders, no. Pag na-address mo yung isa, you're addressing a part of mental health. Pag na-address mo yung sa drugs, meron ka ring ma-address na part ng mental health. Para siyang yung mental health pieces ng puzzle na kailangan mong multifaceted, dapat mas marami kang kailangang i-address doon para mabuo yung picture at makumpleto yung well-being to address your mental health ng mga workers ninyo, making your workplaces mentally healthy as well. So, thank you very much po.
Thank you very much, Dr. Ray. Dr. Felix?
Yes, sa akin siguro from the policy standpoint, no, you always go back to your basics. You always go back to the wisdom of the law. You always go back to why you're doing your policies and programs, who it's meant to be protecting. Tapos, syempre, siguro while you're crafting your policy, you always put in mind yung sinabi ni Jennifer Luxley, in a world where you can be anything, be kind. Kasi pag nandoon yun sa inyong policy, nagiging human-centered yan. Yun po yung lagi nating pinupush sa ating mga policies. If you're going to do an HIV and AIDS awareness and a mental health awareness, nasaan ang inyong manggagawa dito? Nasaan kayo bilang employer dito? Kailangan nandun kayo sa policy mismo. Alam nyo na ito yung galaw natin para masigurado na walang maaapakan na human rights, walang ma-stigmatized at walang makakaranas ng discrimination because of a condition na hindi natin alam or hindi pa tayo familiar. Hindi porket nagsisisigaw at nagtatatawa ay dapat na nating parang katakutan. Maalay natin, masaya lang talaga siya, di ba? So, be kind. Thank you.
Thank you, Dr. Felix. And last but not the least, our very own Lara.
Ayan, siguro bilang parting words, I would just like to thank everyone, no, who attended at sa atin pong mga doctors, thank you very much. I mean, we have learned plenty, ayun, and have become aware, no, very insightful po lahat ng inyong naibahagi. Ayun, at sa bahagi ko naman, no, sa mundo ng mga dapat, I am hoping, no, and we speak about it. We advocate for it, no? We set policies for it because in the near future, what we want is that casual na lang siyang masasabi na hindi ka makokomenta na, ay, that's so brave of you. Or met with with weird stares, no, or met with pity when you talk about mental health. There's just understanding na lahat may level of understanding and awareness. No, that happens. It's normal. No, we have policies in place for it. We have therapy. We have medications for it. No, and lastly, na sa pagsusulong nito, malaking bahagi ang individual. No? Malaking bahagi ang self-awareness na bumubuo ng workplace, na bumubuo ng community. Ayun, kaya napakahalaga po ng pagtatanong natin sa ating mga sarili, no, for example, napakahalaga po ng self-awareness lalo na sa ating emotions, no, sa pagpupush forward at sa usaping mental health in general, no. And siguro reiterate ko lang lastly yung putting a label to our feelings, no, and knowing the triggers behind it, just letting it pass. Thank you, everyone.
Ayan, thank you very much, everyone. And there we have it, our attendees, no? So this concludes our open forum, but please stay with us, our panelists, for the awarding of the certificate of appreciation. So let's now move forward to the recap and synthesis of today's webinar. So on behalf of the ILS management, we would like to thank once again our speakers and all our participants present via Zoom from the DOLE bureaus, attached agencies, ILS attendees today, and those tuning in via the ILS Facebook page. So as a recap, we've seen our presenters talk about mental health today. So to summarize, Dr. Labanda discussed the timeline of mental health policies in workplaces in the Philippines. He also tackled the rise of persons with mental health condition. When in terms of DOLE duties and responsibilities, Dr. Labanda also talked about specific issuances and policies issued by the Department of Labor and Employment. Dr. Santa Ana talked about psychological factors affecting mental health, including work-related stress and psychosocial hazards. He also mentioned the hierarchy of needs created by Maslow and emphasized stress management and how the body reacts to stress. And of course, yung model of work stress in the workplace is corrective measures to prevent work-related stress as well as coping with stressful situations. Lastly, Dr. Santa Ana shared some occupational safety and health studies on mental health that we can also access. And lastly, Ms. Lara Cameron talked about how we can destigmatize mental health at work. She also stated that there are policies and programs in place in destigmatizing mental health at work and those that can be enjoyed by all and for all. She also shed light on stigma, its type, its difference to discrimination, which many people are experiencing, especially in the workplace. Some of the provided strategies to stigmatize mental health were also discussed, which include education, awareness, workplace initiatives, and outreach. So at this point, let's move forward to the photo opportunity and awarding of certificate. At this point, I would like to call on our speakers for the awarding of the certificate of appreciation individually, no? And to award the certificates of appreciation, may I call on our ILS management with our Deputy Executive Director, D.D. Grace, Attorney Grace, and our division chiefs present with us today. So for our tech team, kindly put our first speaker in the spotlight with our ILS officers, no? And we will do the same with the next speaker to be called. The certificate of appreciation is given to Dr. Felix F. Labanda Jr., Supervising Labor and Employment Officer of the Bureau of Working Conditions, for sharing his knowledge and expertise as resource speaker in the webinar titled No Health Without Mental Health, Advancing Mental Health Promotion in Workplaces, held on 16 November 2023 via Zoom platform, signed by our ILS Executive Director, Jeanette P. Damo. Can we have a photo opportunity with Dr. Labanda, please? Ayan.
Take the photo.
Thank you very much, Dr. Labanda.
Welcome.
Okay. So for our next speaker, the certificate of appreciation is given to Dr. Reynold M. Santa Ana, Senior Occupational Health Officer, Health Control Division, Occupational Safety and Health Center, for sharing his knowledge and expertise as a resource speaker in the webinar titled No Health Without Mental Health, Advancing Mental Health Promotion in Workplaces, held on 16 November 2023 via Zoom platform, designed by ILS Executive Director Jeanette P. Damo. So let's put on spotlight our presenter and of course our ILS management for the photo opportunity. Okay. Another for our next speaker, the certificate of appreciation is given to Ms. Lara P. Pameronag, Vice President, ILS Employees Association, Mental Health Advocate of the Institute for Labor Studies, for sharing her knowledge and expertise as a resource speaker in the webinar titled No Health Without Mental Health, Advancing Mental Health Promotion in Workplaces, held on 16 November 2023 via Zoom platform, signed by ILS Executive Director Jeanette P. Dam. So let's put on spotlight Lara and of course our ILS management for the photo opportunity with the certificate of appreciation. Ayan. So there you have it. Thank you very much, everyone. So ILS will send the hard copies of the signed certificates via courier to your respective offices po. That's for our presenters for today. Once again, thank you very much. And for those promoted to panelists, we request everyone to open their cameras for a quick photo opportunity. Tech team. Okay, in 3, 2, 1, smile. And another. 1, 2, 3, smile. Okay na, tech team. Ayan, I guess we're done for today. Thank you very much once again to our panelists and our attendees via Zoom and of course our attendees via ILS Facebook page. So let's now conclude the webinar for today. We hope this session helped our attendees from various DOLE agencies, employees, the business community, our development partners, those who tuned in via the ILS Facebook page, and those interested knowing more about the policies, programs, initiatives in addressing mental health in workplace. Before we close the event, kindly answer our short customer satisfaction survey. The link will also be posted via the chat box, and you can also scan the code visible on your screens right now. Upon submission, it will also automatically generate your certificates, and it will be sent via your respective emails. Kindly provide the full name to appear on the certificate of participation. So for our few announcements from the Institute for Labor Studies Advocacy and Publications Division, stay tuned for our upcoming event. We will be having our $12 research conference that will be held on November 28 to 29, 2023. This will be this month. This will also be live streamed. So if you are interested, kindly visit our website and follow us on our official social media handles on Facebook and Twitter for upcoming updates. Thank you very much and keep safe, everyone.
Of labor market efficiency, industrial peace, and social justice. On July 25, 1987, the ILS in its glory was formally established through Executive Order No. 251 in response to the growing need of DOLE for backups on its present and future labor and employment policy recommendations. they've delivered quality, innovative, and comprehensive research to assist policy recommendations on employment and labor situations. The ILS is headed by an executive director and assisted by a deputy executive director, and made up of 3 research divisions and 2 supporting divisions. The research strategy of ILS is anchored on the 4 pillars of decent work: employment, social protection, rights at work, and social dialogue. For many years, ILS has continually sustained success in the value of its services through strengthening partnerships and systems while establishing effective, efficient, transparent, and accountable use of resources, making the Institute withstand the test of time. Highlighting the past 6 years, ILS has helped solidify evidence-based decision-making and created more knowledge products in support of DOLE's programs and agenda, in the form of working papers, electronic newsletters, videos, webinars, seminars, and capacity-building events. One of the notable ILS researches is the Bike to Work, a survey on use of bike in the time of COVID-19 pandemic. This is a multi-sectoral engaged policy discussion which aided DOLE in crafting a program for workers to commute to work using bicycles. Other pioneering papers of the Institute include studies on work-from-home arrangements, fair working conditions in the healthcare and digital platform sectors, rapid assessments of employment, and social protection programs for displaced, local, and overseas workers. Until today, ILS continues to study the Philippines' labor and employment situation towards the future of work. ILS continues to be committed to uninterrupted operations anchored to its core values of integrity, excellence, public service, innovation, and compassion. The ILS is also guided by its overarching agenda to protect workers and engage wider communities towards a more robust economic scenario leading to a post-pandemic employment recovery. It continues to be at the forefront of bridging labor and employment research, policy, and practice towards inclusive growth to influence and create more positive and impactful works towards a decent work for all.